Supervisor Gray, will you please lead us in the Pledge of Allegiance?
Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ms. Ryan, will you please read the public participation procedures for today?
In order to protect public health and the safety of our Tuolumne County citizens, this Board of Supervisors meeting will be physically closed to the public. During the board meeting, citizens who wish to comment should be prepared to use our call-in line at 209-533-6581 to queue for verbal public comment. Public comment will be open and closed individually for each agenda item listed below. If you wish to comment on a specific item, please call in when the board clerk has read the item. The chair will ask if there are any comments from the public, and at that time, your call will be taken in the order as received. The public comment time limit on each item is set for 3 minutes per speaker. The time limit does not apply to staff. Options for public access, audio and video live streaming. The public will not have access for public comments through these media. These are available for audio and visual only. You can go to our Tuolumne County website under board meetings, access tuolumne.org, and click Watch Live or Zoom webinar via your computer with the webinar ID 987-3738-5155. You can also call in at 616-900-928 using webinar ID 987-3738-5155. Please note, Zoom webinar services tend to have a reduced broadcasting delay in comparison to the county and Access Tuolumne live streams, and is suggested for the closest to real-time viewing and listening. Important public notice. Under the Governor's Executive Order N2520, this meeting will allow members of the Board of Supervisors to participate by teleconference, and under Order N2920, accessibility requirements. If you need swift special assistance during the board meeting, please call 209-533-6581.
Thank you. So at this time, I'd ask if there's any oral communication. The public may speak on any item that is not on the printed agenda. And I'm looking for staff there is no oral communication this morning. All right. Do we have any staff reports?
Eric Aiken, Library and Recreation Manager. Just wanted to come and give you guys an update on our library curbside service program and how that's been going. It's been a lot of work and a lot of effort, and the credit goes to my library staff that's done an amazing job to get this off the ground and created and running, and so far has been a huge success. The last month and a half, we've had approximately 1,000 visits from patrons across the county. We've so far checked out approximately 3,500 materials within the county. We are seeing a great increase in those numbers right now that the schools are back in sessions. A lot of the homeschool families are really starting to utilize that program, so we're anticipating those numbers to go up even more as we move forward. The public is extremely happy that your board allowed us to bring this curbside service program. Some semblance of the library they're very happy to have back. Although I will say the number one question we get is, when is the library going to open? So just to remind the community that we are offering the curbside service program at both our Sonora main branch and our Groveland branch. The Sonora branch is Monday, Wednesdays, and Fridays, and the Groveland branch is on Tuesdays, and those are all by appointment only. So you have to call and reserve your materials ahead of time and set up an appointment time to pick those up. And if you'd like to do that, you can call the library at 533-5507, and we'd be more than happy to get you set up with that. So, thank you.
Thank you.
Yeah, just one question before you go there, Eric. Yeah, and I agree completely with your assessment. It seems to have been really positively received by the community. Are we working on opening, I know we've discussed it, are we working on a plan to open the libraries in some kind of COVID-19 safe way in the near future?
Yeah, we've been looking at some of the neighboring libraries and kind of what they're doing and limiting hours and patrons and things like that. So we're kind of developing a plan depending on what staff we have after the next board meeting to kind of determine how we're going to move forward in opening. I would imagine it's not going to be the full open, our normal hours, but there will be some opening that we'll be able to do.
Yeah.
We're not sure which branches yet, but we're looking at all that.
Okay. Yeah, great. Well, again, thank you very much. I think people don't realize the amount of work that went into this, and I really applaud you
Oh, the library staff
for making it happen.
My staff gets all the credit. They've busted their butts and done a great job.
Yeah. All right, well, thank you.
Thank you.
Thank you, Eric.
Debbie Batista, County Clerk, Register of Voters. Guess what? It's election time. If you haven't been driving around seeing all the signs, surprise, they're all there. On October 5th, every voter in Tuolumne County that is registered will be mailed a vote-by-mail ballot. The voter can vote on that vote-by-mail ballot. They can drop it in the post office. They can drop it off one of the drop-off boxes that we have. We will have 8 in the county. They can drop it off at my office. I highly suggest that if you know how you want to vote, you've done all your homework, vote early and get your ballots into us sooner than later, because between COVID and some issues at the post office, we're going to have some scheduling problems if we get all of our ballots on November 3rd. So what one voter could do is get onto the Secretary of State's webpage, www.sos.ca.gov. One can check one's registration, make sure, especially if one has moved in the last 24 months, 12 months, make sure you're registered at the right place so you'll get the right ballot with the right races on it for you to help decide who the new board members will be. And you can also sign up for Where's My Ballot, which helps us out. If you sign up for that, if you've already signed up, you don't have to do it again. It's one time. You can track your ballot as it leaves and goes to the post office, as it comes to my office, as is accepted in our office. If it's not accepted because you forgot to sign your ballot, it will tell you, and you'll get an earlier warning to come in and fix the issue. So remember, election time is our election day is November 3rd, but there's some things that a voter can do before then to make it a smoother transition. Thank you, and everybody do your homework and vote.
Thank you. Are there any other staff reports? Okay. Seeing none. Heather, will you please read our 9 a.m. appointment?
Presentation and planning status update of the novel coronavirus COVID-19.
Good morning, Madam Chair, members of the board, Ms. Carrillo, Ms. Riggs. My name is Rebecca Espino, Health and Human Services Agency Director. First, I would like to take this opportunity to acknowledge and thank Dr. Ortiz for serving our community for the past 5 months. We wish her the very best in her new endeavors. I would also like to welcome back and thank Dr. Surjenko for once again serving as our interim health officer. We really appreciate him serving our community in the capacity that he's able to. I also want to acknowledge Mariposa County for their continued partnership and support in allowing us to share Dr. Surjenko and his valuable health officer experience. And with that being said, Dr. Surjenko.
Good morning, Chair. Good morning, Board. It is good to be back in Sonora in the county of Tuolumne. So I'm going to hand it back over to Shelley here shortly, but again, wanted to tell you that I'm back and I'm happy to be here and happy to support the county as best I can. Chair Brennan had suggested before the formal meeting had started that I also share a little bit about what else we're doing. I am currently the acting director for the Mariposa County Health and Human Services Agency. We're pending a new hire there. But the other thing that is equally relevant or more relevant for your board is I am currently the area coordination team lead for what's called the Yosemite Gateway Area Coordination Team, which consists of representatives from all of the 4 gateway counties, Mariposa, Madera, Mono, and Tuolumne, as well as Yosemite National Park and other federal land management agencies. We meet as a policy group once a week to discuss issues amongst the 4 counties and park, but as a planning team and an epidemiology group, we meet on a daily basis to look at the data that's going not only in the 4 counties and the park, but throughout the region. So we have a pulse on what is happening, again, not only in the counties, but in the entire San Joaquin Valley region and the foothills communities. So I'm going to pass it back to...
Excuse me.
Yeah.
Just a quick question. You're familiar to us. Could you just give us a brief review of your background and experience for the public?
You bet, Supervisor. Now, I'm going to go ahead and unmask just because I do notice it's a little bit muffled, but I promise not to spit on anyone. So,
Thank you.
Again, Eric Sergianko. I am currently the County Health Officer and Acting Health and Human Services Agency Director for Mariposa County. I am just past my 4th year anniversary as being the health officer there. Prior to that, I had served 27 years in the Navy, retiring as a captain in the Medical Corps. My last job with the Navy, with the Department of Defense, was as the Department of Defense liaison at the Centers for Disease Control and Prevention. Prior to that, over my 27-year career, I will say I bounced back and forth between clinical jobs. I'm board certified in emergency medicine and public health. I did a 2-year fellowship as what's called an epidemiology intelligence service officer with the CDC, working on communicable disease epidemiology in the state of Washington, assigned to the Washington State Department of Health. Prior to that, I was a seasonal park ranger off and on in Yosemite National Park, and oddly enough, my undergraduate degree is in forestry. So I have a weird background, but I think it applies very well here where we're talking about air quality and fires and prescribed fire, and now of all things, a pandemic. So thank you, Supervisor.
Thank you.
Thank you, Supervisor Gray, for asking that question. I was going to get there. And Dr. Sarjanko, I just want to echo Mrs. Spino's comments. Tuolumne County is very appreciative that you have agreed to come back as our interim health director. This board is very, very thankful that you agreed to do that. And especially, please extend our gratitude to Mariposa County. I will also be doing that. We have been very, very fortunate to have many partnerships with Mariposa County. And this is one of those pieces that are incredibly important, and I cannot express the gratitude of this board in your willingness to step up and serve as the interim.
Oh, thank you.
Good morning, Michelle Jaquetta, Public Health Director. I just want to start the presentation this morning with an update on COVID-19 numbers. In the U.S. has seen 6.5 million positive cases with 193,705 deaths. In California, 754,923 positive cases and 14,329 deaths. In Tuolumne County, we have 216 positive cases in residents. 6 of those are active, 193 are recovered. The 216 includes 14 of the Sierra Conservation Center prison inmates. We had.
So I apologize. This was a last-minute slide that we added because the question came up from Supervisor Kirk about bed occupancy. And actually, I'm going to answer his question more specifically offline in regards to COVID patients that have been ICU hospitalized. But one of the things that the area coordination team does do within its EPI section is look at bed occupancy. And this is a heat map that we generate on a biweekly basis to look at bed occupancy within the Central Valley. And the brighter the color, the more yellow it is, the more beds are occupied, the more we're concerned for going into surge. So this is a snapshot from today, looking at, again, from south, from Porterville north up to San Joaquin. And we can see that both in Fresno and in Modesto, we've got some areas that are in the yellow, both for general bed occupancy and for ICU occupancy. This is not COVID necessarily. This is just bed occupancy, because we know that people still have motor vehicle crashes, people still have heart attacks, they still occupy beds. And then what we're seeing is an overlay of COVID patients with that. And so as we look at the percentage of patients that are COVID positive in those beds, it runs anywhere from about 10 to 20%. And that's currently now what's about the percentage of COVID patients in these beds. So we track that because we do know there's a challenge both from Sonora Adventist and from my own hospital, John C. Fremont, in transferring patients up from the foothills down into definitive care. And so we track this. I will say that we are seeing a downward trend in occupancy of both general beds and ICU beds, so that's a good sign, where we're seeing about 18% decline between last week and this week. So again, we're seeing a decrease in the number of cases per week, but also a decrease in hospitalizations, which is a positive thing.
Thank you for that. And I did add a link to the bottom of this slide. It's where hospital and ICU data can be found on the state website and can be drilled down to, if you click on Tuolumne County, you can actually see that data over time, and that's covid19.ca.gov/data-and-tools. This is just a screenshot of our data dashboard, COVID-19 data dashboard. And the yellow line shows the total number of cases that we've seen in the county since March. The red bars at the bottom are the new cases by day. And we're working on getting that data to appear also as a line or an epi curve as well, rather than just bars. So we hope to have that updated before the next presentation.
Michelle?
Yeah.
One suggestion on that, because the values are so different in those two pieces of data that are on there. Mm-hmm. If you had a split axis or a dual axis, it would help people see the trend information, especially on the cases per day.
Okay, thank you for that. Okay.
Good point.
Wanted to also mention again that disease reporting into CalReady, which is the statewide infectious disease reporting system, includes county, state, and federal inmates. The case rate and test positivity rate calculations for the new tiered blueprint system do not include state and federal inmates. The county's data dashboard now includes the inmates in the total number of cases, but indicates separately how many are state inmates. State prison staff cases are counted in the county of residence. The California Department of Corrections and Rehabilitation reports details of the prison cases on their website, which is cdcr.ca.gov, and then /COVID-19/population-status-tracking. This is a screenshot of the state's new blueprint for a safer economy map, which is updated every Tuesday, so we expect the new data and tier placements to show up this morning. We continue to be in Tier 3 orange, moderate, and we'll explain the blueprint tiered system in further detail later in the presentation, but you can see Tuolumne here is still in the orange. So partnerships, Dr. Sergenko did a great job of sharing what's going on with the Yosemite Gateway Area Coordination Team. Again, that's Mariposa, Madera, Tuolumne, and Yosemite National Park and Mono counties. Local, regional, and statewide partnerships continue to be a vital part of our pandemic response. In addition to local 3 times weekly stakeholder coordination calls and bi-monthly healthcare and safety coalition calls, we continue to coordinate with the Yosemite Gateway team. the San Joaquin Valley Public Health Consortium multiple times per week, the Region 4 Medical Health Mutual Aid Advisory Committee. Weekly meetings are held with school districts and the county superintendent of schools Thursday mornings. And biweekly meetings are held with the business community in coordination with Tuolumne County's Innovation and Business Assistance. And in fact, there's a business webinar tomorrow evening at 6 o'clock. We welcome the public and especially business owners to participate in that webinar. For registration and information, you can go to tcdisasterassistance.com or you can email Cole Prisabella at cprzyla@co.tuolumne.ca.us. So an update on testing. In Tuolumne County, at least 10,876 tests have been conducted. Testing is available through local providers, Adventist Health Sonora, and the OptumServe State Testing Site, which is in Angels Camp. Adventist Health Sonora does have the lab capacity to do PCR testing on site, but due to demand, that is limited to medically urgent situations. And all the other PCR tests are sent out to labs. The turnaround time for tests has improved. We're now seeing somewhere around 2 or 3 days for the test results to come back, so we're happy to see that. And we continue to seek opportunities to expand testing in Tuolumne County.
So can I ask a quick question on that? At the last Yosemite Gateway Partnership meeting, there was some conversation about the state having some possible mobile testing capacity, and we talked about the need, especially in our Groveland corridor, to try and get some of that, get access. Has there been any movement on that?
Yeah.
So thank you for the question, Chair. Is the state is proposing that there be a total of 80 mobile teams that can deploy to anywhere in the state. Currently, there are only 3. The first of which went to Madera County, is working with the ag community there on testing. So as we see more come online, I think we'll be able to direct them to where they need to go to help support us in our case detection and identification. So I will say it's definitely a work in progress. Talking with the team in Madera, negotiating with not the state, but the contractors for the state has been a little bit of a challenge. But again, I think that's true with any of the contracts we've seen for testing is they come in with one set of expectations, and then we have to correct that. So more to follow.
Thank you.
Again, free testing is available at the OptumServe State Testing Site at the Calaveras County Fairgrounds. It's open 7 a.m. to 7 p.m. Tuesday through Saturday, and appointments are strongly encouraged. There is some walk-in availability, but can't be guaranteed, and so we do recommend that folks make an appointment at lhi.care/COVID testing or by calling 1-888-634-1123.
Michelle? Pardon me for interrupting. The question I continue to get is if someone gets tested multiple times, do they count as one test or do they count as multiple tests? And my understanding is a unique individual, no matter how many times they get tested, that's one individual that got tested.
That's correct.
Okay.
Yeah,
The question I have then is, for instance, in my own personal case, I've been tested 6 times, 4 times at OptumServe, which, by the way, works very well, so I highly recommend people go there. I did get tested once at the hospital, and I was tested once out of state to enter a bubble. What is there correlation between sites that ensures that I'm only counted that one as one individual?
Yeah, test results are reported by county of residence, so all 6 times we would get that result, but still only count that one.
Okay,
So.
and I asked that, confident that that was the case, but
Yeah.
I keep getting those questions from my constituents. Thank you.
Sure. So testing continues to be an important part of the pandemic response. It allows for early identification of disease and enables us to do case investigation, contact tracing, isolation, and quarantine to help contain the spread. And it reduces the test positivity rate and increased testing volume. that provides adequate surveillance so we know we have a good picture of the disease activity that's going on in the county. We will talk a little bit about test positivity rate again in just a couple of slides here. So testing recommendations, we do recommend that if you're having symptoms that you get tested right away. If you regularly work with the public, to get tested every 14 to 28 days. And if you've traveled or had close contact with others who are not part of your family bubble or household, that you do that 5 days after the contact or 5 days after your travel. If you have symptoms, self-isolate and contact your healthcare provider. And you can get testing through your healthcare provider, the OptumServe testing site, or you can reach out to Adventist Health's triage line at 536-5166. The website valleycovidhelp.com also provides helpful resources. Okay, I'm going to let Dr. Surjenko talk a little bit about the blueprint for a safer economy.
So the state about 3 weeks ago proposed moving from the county data monitoring list to a blueprint for a safer economy. And the intent was to move decisions about restrictions and non-pharmaceutical interventions closer to where they need to happen at the county level, but still have some oversight from the state. And there are two primary criteria to move back and forth in these tiers that I'll talk about in just a moment. One is the case rate, and that's the average number of new cases per day over a 7-day period for a population of 100,000. So we have to normalize it for Tuolumne's population. And then test positivity, which is the percentage of positive COVID tests over a 7-day period. There is other criteria that is being proposed for counties greater than 100,000, and that's health equity. That has been a work in progress. Initially, it was going to apply to all counties, but as a small county, we advocated for not doing that because they were going to use what's called the Healthy Places Index. And the fidelity of data as you get, or I shouldn't say the fidelity, the ability to actually differentiate between disproportionate areas is harder to do in rural communities. So we successfully advocated for counties below 100,000 not being included in the health equity measure. But it's worth knowing because that question will come up from your constituents. Next. So the framework, again, uses the case rate and the test positivity. Those are indications of disease burden and the ability of the county to test. And that drives into which tier that you will go into. County may elect to be more restrictive than the state-assigned tier. I do not see that happening in any of the foothill communities, although there may be specific sectors where I will make recommendations to be more restrictive or provide more guidance. As an example, the health officer's order on lodging. And I did mention to County Council I'm going to be modifying that so it does fit into the tiers, and it'll be less restrictive for orange tier, which we're in now, than it is currently written. So look forward to doing that. If a county's case rate and test positivity measure fall into two different tiers, the county will be assigned to the more restrictive tier. And then, as indicated here, there's no changes based upon density of population. And we continue to work as health officers with the state on sort of creating a variance for small counties because we recognize that a small cluster in Tuolumne County could negatively impact us. And if we understand the disease transmission and can get our arms around it, we don't feel we should be penalized because of that one cluster.
Dr. Surjenko?
Yes, sir.
Just to add to that, I participated in a CSAC board meeting at which the state public health officer was taken a little bit to task, and I don't mean that disrespectfully to him at all, but by principally rural counties. And then he had I give him kudos for this, he had a conference call with a number of us last Thursday, I believe, and he is committed to continue to meet with us, a small group of us, about 10 people, on a weekly basis, and we are pushing I think, for the same kinds of things. My understanding is I'm going to be part of that group. So let's help keep each other informed of where we're going so we're singing at least in harmony there.
Thank you, Supervisor. Yeah, so I appreciate the efforts of both CSAC and RCRC in advocating for the rural counties because, again, we are different, and recognizing that has been an important step for us in working with both the California Department of Public Health and Secretary Galley. So this is just a snapshot of one of the guidances, but I think going across the top is really probably the most descriptive thing is that we do have these 4 tiers from most restrictive to least restrictive. The most restrictive being the purple, which is tier 1, to the least restrictive being tier 4. As you get less restrictive, you are able to do more things, reduce the number of what we call non-pharmaceutical interventions, allowing for more things to come together. So I think that's a very positive thing in that we will have a sense, and again, you have to give kudos to our epidemiology team within the area coordination team is that they're doing a better job of tracking our own data, and we have that good communication now with the state where if we see something going astray with their data, we're able to provide course correction. And Dr. Nunez, our lead epidemiologist, we're in sync right now with the state for the 4 YOGAC counties, the Yosemite Gateway Area Coordination Teams. She is noticing some variance for counties that are outside of our coordination team, but is continuing to work with the state on correcting those. But again, this is an example of how we can open up our sectors of economy safely and with accepting some risk of increased transmission, but that would be manageable with the resources that we have. Next. So we are currently in tier 3, the orange tier, and I tend to refer to colors rather than saying moderate or tier. But I suspect other people will say moderate or tier 3. So just knowing that all 3 apply. And so these are the things that are open with limitations, and then open outdoors are things like bars and breweries. And that really, for most rural counties, is the big difference between tier 3 and tier 4, is that in tier 4, those things that are open outdoors right now, like bars without food service and breweries without food service, those can move indoors. So I think it'll be a goal for us as we move towards hopefully less smoky weather, but colder and wetter weather, that we're able to move indoors. Because I can tell you right now, I would like to have these indoors as well, just from an air quality standpoint, but recognize the state has been very specific about the concerns with having indoor gatherings. And I will say there was a recent publication in the MMWR that indicates that dining indoors actually increases your risk of COVID by 2.5 times. So worth noting there is, again, some risk with moving activities indoors. Next. So again, moving through the tiers is something that we can anticipate doing, and this arrow should be going in both directions because we can actually move backwards as well. If we remain with a lower criteria for 2 weeks in consecutive weeks, we can move forward. So as an example, in Mariposa, we have had 1 case for the last 2 weeks. If we continue to trend that way, Mariposa will move into the yellow tier as early as the end of the month. Conversely, if we have worsening metrics for 2 consecutive weeks, we move into a more restrictive tier. The data is pulled from Saturday to Saturday, and then it's frozen on Sunday, analyzed on Monday, and as Michelle indicated, is released on Tuesday. So as always, the things that we can do are the individual actions to help us move to the next tier. So staying home if you're sick, washing your hands regularly, maintaining that social distancing, wearing a face covering, and as Supervisor Rotifer has done, get tested on a regular basis. That's not just for symptomatic testing, but for prevalence testing as well. So just knowing what the activity of disease is in the community. There are a number of infographics that we've developed as the Yosemite Gateway Area Coordination Team so that different sectors know what their businesses will look like and what customers can expect. This is just an example of that for restaurants, and that's available not only for Tuolumne County, but for all the counties that are in the Gateway Area Coordination Team. So questions have come up about schools. Realistically, in the orange tier, it doesn't change things a whole lot. And so we'll continue to follow the current state guidance. And as the board is probably aware, we've had a number of school districts in Tuolumne that have opened for in-person investigation or instruction. Next. Again, sort of repeating the message is that always do those personal individual actions that will reduce disease transmission. And then I'm just going to hand it back over to Michelle for the rest of the talk about Blueprint.
Thank you. We wanted to give a little update on the Education and Compliance Division. Since the last board update, we have received 27 complaints at 10 facilities. There were 10 first site visits and 5 follow-up site visits. Approximately 67% of the facilities have been successful in addressing the complaints that were brought forward. And when accounting for the facilities that were not applicable to the Education and Compliance Division, we are at 80% in compliance. There have been 13 technical assistance and plan reviews that were conducted. 7 new requests for PPE for business-related expenses related to COVID have been submitted. And the total COVID-related business expenses approved are about $35,000. All of the requests have been approved, and one of the requests was withdrawn. The business operating guidelines continue to be the same. All businesses must complete and operate within a site-specific safety plan. They need to post a copy at their business for the public to view and send a copy to the Public Health Department at our email. Guidance documents for the different sectors are available at covid19.ca.gov/industry-guidance. And the Tuolumne County Innovation and Business Assistance, again, has their website, tcdisasterassistance.com. And business owners are always welcome to give us a call at 533-7440 or email us at health@tuolumecounty.ca.gov. And I did want to mention once again that there's the business webinar tomorrow evening at 6 o'clock. So we hope that business owners will join us there. We wanted to provide an update on some new information that we are receiving regarding COVID vaccination. The vaccine for COVID-19 is in production, and initial distribution will be limited when it comes out. Public Health will receive a limited amounts for distribution to facilities to provide for prioritized populations. Those are those at highest risk, healthcare workers, first responders, those in the most vulnerable groups. And we may receive that first allotment by the end of the year. So Public Health is beginning to plan and coordinate within and with our healthcare and safety partners for that process. Communications and information continues to be the same. We have our COVID-19 data dashboard, and that's easily accessible through the Tuolumne County Public Health website at tuolumecounty.ca.gov/public health. You can also, there's a link to it on our Facebook page. Our Facebook page is still active. That's facebook.com/Tuolumne County Public Health. Again, the official county website. And we have a community resources portal. That's bit.ly/TC COVID portal. And again, our call center is active Monday through Friday, 9 to 5 at 533-7440. And that email, health@tuolumecounty.ca.gov. And that is the end of our presentation, unless there are questions.
Okay, so before I go to board questions, I want to, Michelle, thank both you and Rebecca. We had an Area 12 Agency on Aging meeting last week, and the conversation around vaccinations did come up, and understanding that we'd be looking at some of those vulnerable populations. And again, want to thank you for the proactive work, and they did report out that you're already working on what, how those vaccinations, might be distributed. And I just want our senior population to know that that work is ongoing, and plans are being developed at this time on how that will roll out. So thank you for that. Are there any board questions?
Yeah, I have one. First, I got to ask County Council if I can ask the question. It's COVID-related, but we're going to be discussing item 16, about a COVID committee. And my question is to Dr. Sujanko is that, in your opinion, is that type of committee beneficial to the spread of COVID as far as helping with helping you or your team in doing a better job?
So I'm going to look at county council really quick and make sure I can.
So, I mean, I think that it's, you probably can't ask that question, but the best thing for the Brown Act is probably to also read item 16 so that that question can be asked.
Okay, I want to, is that all right for her to read item 16?
Yeah.
Okay.
Item number 16, Supervisor Kirk, consideration of developing a board committee on COVID-19.
Can I clarify? The intent is not to address item 16 right now, but to
Ask a question
ask the question, and
Right,
we'll
you
go
can
back to.
later.
Thank you.
Okay, thank you.
while he's here.
Be very clear. Yes, thank you.
Yeah, no, thank you, council and board. So the question is what's the scope and role of that committee? I will say that at this point in time, one thing that I would recommend is using more of the resources that are available from the Gateway Area Coordination Team. So there's a lot of data that they're developing, and we also have a partnership with UC Merced to do those sort of academic questions, recognizing that a committee would likely be made up of clinicians who are otherwise really busy. You need that time to be able to do the deep dive. So my concern is by creating a committee is you may be tasking staff to do more homework. And so I would say that the idea is to build out those networks that already are in place so that we can get the questions asked that we really need to get answered. And so, again, use those existing, again, the Yosemite Gateway Area Coordination Team, and then our liaison that we have with UC Merced to ask those deep dive questions, I think would be as valuable as having a separate committee.
All right, thank you.
All right, I'm going to ask if there are any other board comments on the 9 a.m. appointment.
Two things, I guess, well, three things. One, I want to make it very clear that we, as a board, very much appreciate the months-long, probably longer than she envisioned, efforts of Dr. Liza Ortiz as our public health interim public health officer. Two, I want to echo what a couple of supervisors have already said, and that we're very happy to have Dr. Surjanko back, a highly qualified and very capable public health officer as our interim public health officer as well. And thank you for, I know it's a personal demand on you, and we very much appreciate it. And then the third thing, and really probably equally as important, is I would like Rebecca and Michelle to take back to our entire public health team our constant appreciation for their unending efforts. They're working unbelievably hard and have been through this whole thing. This is way more than they probably signed up for, or whatever, however you would express it. And I think not always when you're at the end of a phone call with a member of the public do you feel that appreciation. But I want you to know that at least Carl Rotifer on this board very much appreciates the work that you're doing, and please pass that on to everyone.
You can put me on that list, too.
Thank you very much. I'll definitely.
The entire
share that
board
with
on that list.
Okay, thank you very much.
Thank you, Supervisor.
Yeah, and I'll just echo those comments. Thank you very much for your hard work, and welcome back. It's nice to have you, and thank you for all of your efforts.
Okay. Supervisor Kirk?
Yeah, I do have 3 questions, just pretty short and simple. But before that, just thank you, Dr. Surjanko, for coming back. I appreciate it. I appreciate your tone. I appreciate your expertise and the way you communicate with us and with the community. It's refreshing. So thank you. I just want to clarify something you had said earlier. I didn't want to interrupt you, but about bed capacity and surge capability. I believe you rattled off the number 20%. I just wanted to clarify. I think you said 20% of the bed occupancy was COVID related. Did I hear you correct?
So unfortunately, I just closed my laptop, so give me 30 seconds here.
No problem.
And 20 is the highest percentage. It varies from site to site. And let me see if I can. And actually, if we look, the highest number, and I've got most of the counties here, is the highest in our region is Calaveras, which 40% of their bed occupancy is COVID related. And the lowest is Fresno currently, well, Tuolumne and Mariposa aren't on here because they're at 0% right now. And then the lowest is Fresno at 10%.
Okay, so those numbers are for the region between about 10 and 20%, correct?
Correct. Yeah. So again, the highest is Calaveras at 40, but the next down below that is Kings, which is 25%. Then San Benito at 17%, Madera, and so on and down all the way down to Fresno, which is 10%. And
you said that was kind of,
pardon?
That was kind of a downward trend.
Right. So again, the other thing we're looking at in terms, so that's current percentages, but if we look at trends over time, and let me scroll down to that one, is that we're seeing a downward trend in all of the counties for hospitalization. And even it had been last week is that Merced County was an upward going county with all the other counties going down. But in the region as of today, all of the counties are improving to some degree.
Okay. And then I know some private schools and recently some more public schools have been opened. Have you heard of any COVID-related cases regarding children to teachers, anything with schools?
I have not within the state of California at this point in time. So I think that's something that, again, as a state and as a region, we'll need to pay attention to because, we're about 1 to 2 weeks in for a lot of in-person schools. And we have had reports in other states of transmission in schools, but not in our state.
Okay. Okay, and then my last question or comment just kind of went back to item number 16 because I know you're leaving. I don't think you're going to be around for that. And Supervisor Gray have brought up the question. So you have with this gateway community, you have other doctors, epidemiologists, you have UC Merced, you have all these folks doing research and data, and that's all great. My question is any of that being shared with the state public health officer? Is any of this information, is it just for you guys internally, or is there some lobbying going on with your group at the state level? Because, you made reference earlier that, rural communities are different. We have different, we're just different, just talk about case density for reference. So it's great that you guys have all this information, but is it being utilized to lobby the state on behalf of the rural counties, and specifically, your county and Tuolumne County?
The answer to that is yes, but that's why I also made my expression of support to Supervisor Rotifer is we do advocate through CHIAC and through HOAC, which are our professionals associations for health department directors and health officers. But sometimes we need that political muscle at the CSAC and RCRC level to make things happen because, to be honest, there will be decisions that are made at a science level, if you will, that sometimes gets into conflict with policy.
Right, and so there's an acknowledgement that there's a scientific piece, but then there's a political piece, and it appears to me that the political piece has been moving forward while perhaps a lot of science has been neglected, and that's just based on my own research and the research of some of these local doctors and nurses and what they're seeing.
So
do something
Supervisor
about it.
Kirk, I'm gonna kind of interrupt you here for a second because we're not having the conversation at the time, and I appreciate the question of Dr. Sarjenko. And if you have another specific question, I think that would be valuable to ask at this time, but then we'll have to save the conversation when we have the item.
Just, I did sit on that call with Supervisor Rotifer. But yes, if there's any way that we can team up and relay information to the political venue, through that conversation, absolutely. And kind of like Supervisor Rotifer said, I would like to stay close in communication so that we're presenting that appropriate information, through our channels, and I appreciate that.
Very, very good. And I think that we can provide updates on what the Yosemite Area Gateway partnership is doing when we have these reports, because I know there have been some items that have been brought to the board. But again, with Dr. Sarjenko here, I think he will be able to provide some very concise updates on what that group is doing.
Thank you. Sure, Brennan. I do have one, I guess it's a question left. And I don't mean this in any way as a criticism, but I've said on this dais on a number of occasions that there's more to public health than just disease management and disease control. We're seeing a lot of negative impacts associated with our response to COVID. Specifically, suicide attempts are up, especially among our youth. Clinical depression is up, again, significantly among our youth. Calls for response to domestic abuse and violence are up, many in households with children. The question I have is, I'll phrase it as a statement. I would like to be able to assure my constituents that these factors are being used in the overall equation of how we're responding to COVID-19. And I have never heard that from the public health community in any of the presentations that we've done or any of the updates or anything. So I'm giving you this opportunity to speak to those items.
So I think that's why the transition to the tiering system is important, even though the calculus isn't in there for those other criteria. It allows more maneuverability, and as you open up sectors, then we can open up those things like behavioral health, so we can get people back to school, so we can get closer to normal. But again, as I've told the board before, the normal that we get back to, and you'll notice, well, it's not on the board anymore, but getting back to green doesn't happen until we get a vaccine out. So the question is how we can adjust our services so we can get those out to those people while we're operating in an orange or yellow environment.
Thank you.
Okay, at this time, I'd ask if there's any public comment. Tracy. Go ahead, sir.
Okay, Dr. Surjenko, great to have you back. Really, really great to hear your presentations. They got a lot of good content to them. You're not just repeating stuff. Also, Carl's last comments I thought were well-spoken, and I think it's critical for us to think about the fact that not only are emergency rooms often empty, but there are nurses being laid off, et cetera, because people aren't going into the hospital, and as a result, they're having problems and maybe dying from other things other than COVID, probably in greater numbers. Dr. Surjenko, have you been on top of some of the comments that came out in the New York Times and on August 28th regarding some of the false positive problems that the tests have been giving us?
So is this in regards to antigen testing?
Yeah.
Yeah, I think, the concern with antigen testing is that it does have both false positive and false negatives. And so at this point in time, the state does not count antigen positive test as being a confirmatory test and requests that it be followed up with PCR. And then the other thing that I'll say is that the guidance from the FDA on the antigen testing is to use in symptomatic individuals only, and that reduces both the rates of false positive and false negative tests. But I will say antigen testing is still a work in progress. So again, why the state does not count those as confirmed cases.
Well, in the New York Times article, it specifically was talking about Thermo Fisher's test where they're doing 37 ramps in terms of amplification, and anything over 30 ramps gives us just a myriad of false positives, maybe up to 70%. So my question would be, when we're doing a PCR test, for example, at the hospital, and they're using Thermo Fisher's Master Mix, and they have problems in terms of that usage, and then they're ramping it 37 times, and we get a positive, is that really a positive, or is it part of the 70% of false positives that are coming from using Thermo Fisher's particular test? And if we do get that false positive, are we going back to a different test to confirm or deny it? Let me just say one more thing here, and that is the Detroit Lions football team evidently had 19 false positive cases in retesting. None of them were really positive, and I'm just concerned because I think what happens is after a while people are thinking, this is the scientific community is giving us this wolf cry, and people are looking around them and saying, well, where are the bodies? Is this really happening? And I'm concerned about it because we lose credibility.
So, yeah, in regards to the specific, so I'll work backwards in terms of the bodies. There's clearly, from an epi standpoint, people that are dying from lab-confirmed and culture-confirmed COVID. So we know the burden of disease to a certain extent. But then in regards to the Thermo Fisher, I would have to do more digging into that and see where the specifics are. But as an example, here in Adventist, they don't use that platform, nor do we use that platform in Mariposa.
Okay.
Are they using the Roche, do you know, or which one are they using?
I can take that offline.
Yeah. Could we do that, please? We do, unfortunately.
Well, let me just say one more thing then off that subject. But the optics of looking at this meeting are interesting to see that the health officers are masked and 3 of the Board of Supervisors aren't. And it says something to the public regarding your politics.
All right. Thank you very much for your comments. Do we have any other public comment? All right. Very good. Again, Dr. Sarjenko, thank you for joining us and being a part of the team. Anaya?
Yeah, hey, I just wanted to touch one last thing that I don't know if it was Dr. Sarjenko, but somebody said about the tier system potentially going into the green once we have vaccinations. Governor Newsom on August 28th said that he didn't put green up because we don't believe there's a green light, which says go back to the way things were. So even Newsom is saying that there's not going to be a green piece of the tier. So I just wanted to make everybody aware of that.
All right. Thank you. Thank you very much.
Thank you.
Okay. At this time, Ms. Ryan, will you please read the consent calendar?
Item number 1, approving the minutes of the September 1, 2020 and the September 3, 2020 meeting. Item number 2, adopting resolution 85-20, renewing a local state of emergency and imminent threat of disaster due to severe and persistent fire danger. Item number 3, approving the contract renewal with Jump Technology Services, LLC for the LEAPS Adult Protective Services and Public Guardian System, authorizing the board chair to sign the contract. Number 4, amending the agreement for preparation of a climate action plan for an additional amount of $45,780 for a total amount not to exceed $182,868. Item number 5, adopting Resolution 8620, delegating Article 34 referendum administration to the Community Development Department and naming the Community Development Director as signatory. Number 6, approving the purchase of real property from APM 003-050-006 for the Rawhide Road Bridge Replacement Project number 1331 in the amount of $85,000 and authorizing the chair to sign the agreement. Item 7, adopting Resolution 87-20, accepting the CAL FIRE Volunteer Fire Assistance VFA Grant number 7FG20028 in the amount of $13,387.48 and authorizing the county administrator to sign any subsequent documents. Item number 8, as the Air Pollution Control District Board, approving the Farmer Program Memorandum of Understanding between the Placer County Air Pollution Control District and the Tuolumne County Air Pollution Control District fiscal year 1920, year 3, authorizing the Air Pollution Control Officer to sign. Number 9, approving the OES Coordinator class specification, position, allocation, pay range, and bargaining unit assignment. Item number 10, approving the appointment of Catherine Driver to the Tuolumne County Commission on Aging for a term to expire December 31st, 2022.
Would any member like to pull an item? Okay, hearing none, I'll ask if there's any public comment on the consent calendar. Bring it back to the board.
Madam Chair, I'll move we approve the consent calendar.
Second.
I have a motion from Supervisor Campbell, a second from Supervisor Rotifer. Will you please do the roll call vote?
Supervisor Brennan?
Aye.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Gray?
Aye.
Supervisor Rotifer?
Aye.
Motion carries 5-0. Thank you. Will you please read item 11?
Presentation of State Route 49 complete streets and congested corridor plans.
Madam Chair, I can begin while he's setting up, if you like.
That would be wonderful. Thank you.
Okay. Good morning, Madam Chair. Darren Gross, the Executive Director of the Tuolumne County Transportation Council. With me today is Tyler Somerset. He's a senior planner with the Transportation Council as well. And on the line, we have from Caltrans, Charles Carroll. He'll be doing a presentation today talking about the congested corridor plan that they've put together at District 10 after securing funds through the district. Also, we have on the line Derek Kirkland and Brian Gant from Wood Rogers. Wood Rogers works for the Tuolumne County Transportation as a consultant after we secured grant funding to look at a multimodal approach and complete streets on the Highway 489 corridor. They began their work, which was then later supported by Caltrans efforts. These were two separate efforts. We've merged them together for more clarity for the public to be able to comment on the holistic approach to solving congestion and providing better mobility on the Highway 49 corridor, all the way from Chicken Ranch Casino area through Jamestown, Sonora, up to Columbia College. This plan provides a guiding document that we will use and actually will make us eligible to compete in important programs like the Congested Corridor Program administered by the California Transportation Commission. It's part of SB 1 funding as well as the state and local partnership program. Additionally, it will guide our investments in the corridor from the State Transportation Improvement Program, the SHOP, the State Highway Operations Program, Caltrans maintenance efforts, and grant applications such as the Active Transportation Program. It's a very meaningful document. It also will guide our investments on the corridor supporting infill development, which is a very low VMT area consistent with your county general plan as well as the city general plan. So with that, I'm going to ask Tyler, are you guys ready to go?
Let's see here. There's Charles. Can you hear us?
I can hear you.
Okay, great.
Can you hear me?
Loud and clear. Loud.
All right.
Go ahead, Charles.
I made you co-host, so you should be able to share your presentation.
Okay. All right, I'm going to go ahead and share my screen then. Okay. Can you see the presentation?
Yes.
How's that look?
Looks good. Go ahead.
Can you hear me?
Yes.
All right. That's great. So I'm going to get started. All right. So I'm Charles Carroll, Associate Transportation Planner with the California Department of Transportation, Office of System Planning and Goods Movement. And thank you for giving me the opportunity to speak to you today to share the Sonora and Jamestown 10849 corridor study. We're going to go over the basics of what the study was and the strategies we looked at and the results from some of our analysis in this study. Okay, so the purpose of this study was to evaluate multimodal strategies that address corridor congestion and enhance active transportation. So the steps involved were documenting conditions, using performance assessments to evaluate facilities, presenting and analyzing strategies, documenting results, reviewing the draft, and giving the opportunity for the public to weigh in and comment, and then to publish the study. So the needs: reducing congestion on the state highway, enhancing safety, and enhancing active transportation. And the scope of this was from Chicken Ranch Road to Parrots Ferry on SR 10849. So this gives you a basic idea of what the steps were. Everything from the scoping effort, gathering information, performance assessment, potential projects, analyzing improvements, prioritization, publishing, and monitoring and evaluation. I would say right now we are pretty much at the sort of the near the publishing of the corridor plan. We are in that the phase we are in now is the review, the administrative draft review and comment period for this document. This shows you the coverage area So pretty much from down here near the Chicken Ranch Rancheria, near Chicken Ranch Road, all the way up to Parrots Ferry here in the north. That is the area that we looked at in our study. So in this study, we a lot of the strategies we looked at in this study included bits and pieces, at least, from a variety of listed projects in the 2016 TCTC RTP. So this map shows the coverage of those proposed projects in the RTP, and we made an effort to cover the entire corridor with this view of wanting to look at test or wanting to look at the strategies that are already in the RTP. So this map basically shows that, at least in part, the strategies that we looked at in this corridor study reflect or are similar to the listed projects in the 2016 RTP. So this table shows the list of strategies we looked at. So up here, we can see these are all the different strategies and possible projects we looked at that we tested. And over here, along the rows, we have the goals and objectives of the corridor study. And what we have here are the strategies that met a goal or that met an objective. And if that was the case, it's highlighted with a green Y, meaning yes, they met the goal. Otherwise, it would be deemed N for not having met a goal. The U, it depends maybe on local conditions, but in general, roundabouts do show safety enhancements for active transportation users. But otherwise, the chart does indicate what strategies overall met a goal. And down here at the bottom, we have percentage of goals met. This is just a basic calculation of all the goals that were tested for each strategy, the percentage of success for the overall success rate of each strategy is listed down here at the bottom. So what we have here is a comparison of non-motorized strategy performance and rankings. So we looked at strategies that affected highway operations, but we also looked at possible improvements that affected active transportation users, such as bicyclists and pedestrians. And what we got out of this was we looked at 5 general types of non-motorized strategies and projects. And overall, the active transportation pathway was the best performer, ranking at number 1 overall. Updates to ADA updates to sidewalk, intersection, curbs also did very well, showing a gap fill need of about 97% better than the existing condition. 8-foot paved shoulders along the state highway ranked pretty well, 3rd overall, showing in general 85% improvement over existing conditions in terms of the paved shoulder along the state highway. So this is a summary of what our results were. The 5-lane widening scenario performed best in both 2018 and 2040 conditions in our modeling. That means that overall performance, this 5-lane scenario did the best in terms of reduction of queuing, reduction of delay, overall improvement in terms of greenhouse gas emissions reduction. Number two, the signal timing adjustments at Rawhide and Fifth Avenue performed fifth best overall in both the 2018 and 2040 conditions. So that's adjusting the timings of the signal in relation to the Rawhide intersection, which is about a quarter mile away. So we wanted to see what we could do in terms of reducing the congestion in that area right now near Jamestown. And we used a type of program to do a test on how much reduction of congestion and delay we could get from adjusting the signals. Active transportation pathway performed better in the 2040 condition, so it did show some improvement in 2040. So it is something to certainly consider. Even from an operations perspective, it did show some benefit in 2040, and that would be a separate protected pathway for cyclists and pedestrians generally going adjacent to or parallel to the state highway from Chicken Ranch Road all the way up to Parrots Ferry. The Rawhide realignment performed well in both 2018 and 2040 conditions. The all strategy scenario did well in both conditions as well. This included a variety of possible improvements ranging from lane widening to realignment to the inclusion of a possible roundabout. And generally, this strategy did pretty well, especially in 2040, where it came in second best overall among all the tested strategies in modeling. The Greenlee extension performed better than the no-build conditions in both micro and macro simulations. So what that means is we used a type of model simulator for micro, for minute analysis where you can actually see the cars moving and you can actually see the pedestrians crossing the streets. But we also used a macro simulation tool that sort of looks at things from a regional and interregional perspective. And under both of those models, the Greenlee extension did pretty well. So it reduced congestion in downtown. That's the key item that we were looking at when we ran these models. And in both of those situations, the extension did reduce delay and queuing in downtown Sonora. Number 7, the Western bypass scenarios. These come from the 2016 RTP. They're both listed as a tier 3 project, the locations of which have not been determined. But we did go ahead and run some analysis on this, and they did show minor reductions to volume as opposed to the Greenlee extension. We think this may have something to do with Jamestown Road or Rawhide Road already acting as somewhat existing bypass opportunities around downtown Sonora anyway, but they only showed minor changes or minor reduction. However, they could fill an existing gap issue in terms of STAA terminal access truck facilities along the state highway, if such a facility were ever built to current expressway standards. So going on a little bit further on that, existing highway truck network conditions, we did take a look at the existing conditions in terms of what types of trucks are allowed in the area. And this map shows the California Legal Advisory section starting from Ponderosa Drive at post mile 17.3. And this section down here is your terminal access, the blue line. And Traffic Ops did a rough study on what would have to happen if the facility as is, the existing facility, were to be converted into a terminal access facility. And as you can see here in the photos, it would take a chunk out of the historic Sonora Inn. So really, it was just we just wanted to get a clear picture of what would have to happen if if we attempted to modify the facility that's there now. You can see there's another photo here down at the right between the Calaveras County line and Parrots Ferry. And so, yeah, this does indicate that the one thing working for a potential western bypass would be that it would be terminal access standard if it were ever built.
Can I ask a question?
I think I might have skipped a slide there. Okay, so this map on the left shows you the posted speed limits.
Charles, can you hang on just a minute? We have a question.
Oh,
So I just
sure.
Yeah, I've got a question on that, and I understand we're looking at State Route 49, but there's another alternative, which is to just go straight up 108 and then come in, make the left off of the highway and come straight down Washington Street. So that you avoid, the comments were made about the need to, dramatically impact the historic Sonora Inn, which I understand, looking at this. But again, the majority of truck traffic operators that I know, that know the area, don't go that way. They simply just go down 108 and, like I said, come straight in Washington Street.
Yeah, and I think that, and Charles, you can correct me if I'm wrong, but they're primarily looking at how to make their highway facility compliant with these standards. That doesn't mean there aren't workarounds.
Okay, because I understand conceptually, but again, practically, and from what is realistically happening today. Okay, thank you.
And these are the big STAA trucks, which are the really big interstate trucks. Trucks are certainly allowed on Highway 49, just not the ones that meet that federal designation, which is somewhat rare to be met on even local roads.
Yeah.
I think I have two questions or points. One is ever since I've lived here, I've long not understood why 49 is routed the way it is with respect to what Supervisor Brennan's talking about. It would make much more sense if 49 continued on coincident with 108 until Washington Street, and that's just a redesignation of the highways, I think. That realistically is a less congested and a less constrained routing. The other point that I would make is that there are other aspects to 49 post the or north of the Parrots Ferry intersection that make truck traffic along that route problematic anyway. So I'm not sure, absent straightening out 49 between, say, Tuttletown and the top of the hill there in Calaveras County, I'm not sure, what value we have in worrying about that. But again, I think Caltrans ought to look at how they've designated Route 49. They need to look at redesignating it to be coincident with 108 until you get to Washington Street, and then Washington Street becomes 109 straight through town.
That's great input, and we'll take that back with us. Thank you.
Thank you.
Charles, go ahead and continue if you like.
All right. Thank you. So this shows. Let me go to the next slide here. So this covered truck network conditions. This talks about posted speed limits. So on the left is a map that shows the posted speed limits. And again, if any of you have a question, just let me know, and we'll do our best to answer your question. But I'm going to take a look here at the map on the right at the moment, and that map shows tachometer run timed points. All that is we conducted a couple tachometer runs back in 2018, and the purpose of that was to show actual speeds, actual vehicular speeds in the corridor area, and compare that to the posted speed limits. And we had timed points along the way to keep track of segments and what the median and average speeds were in each segment. And so that's what the map on the right indicates. The results of that tachometer run are as follows. And the blue line indicates the posted speed limit zones, and the green and the yellow and orange lines indicate the average speeds we accrued during our tachometer runs. And as you can see here, we had two general areas where we noticed a delay, noticeable delay on the highway. One pretty much being between Main Street and Rawhide and Jamestown, and the other location pretty much being in downtown Sonora, more or less between somewhere, generally around Bradford to East Jackson. We were noticing some degree of delay. And the speed is indicated on the left. So we noticed some moments of delay ranging to less than 10 miles an hour going through downtown Sonora. And that was generally, and times listed, we pretty much went out there for almost the full day a few times, from about 7 a.m. to about 5:45 p.m. We were out there going back and forth doing tachometer runs. So existing conditions, camera traffic data collection. So one of the things we did to collect data was we placed cameras throughout the corridor, the purpose of which to collect volumes, vehicle volumes with a class breakdown, including buses and trucks. And in addition to that, we also collected pedestrian and bicyclist data. So the map on the left shows where we put the cameras. We had one at Montezuma Junction, Chicken Ranch, Rawhide, near the 10849 split, the fairgrounds location, the corner of Washington and Stockton, and near Sonora High School, as well as one up near Parrott's Ferry. And the image on the right basically gives a breakdown, a turning movement breakdown, the example here being at the Rawhide intersection in Jamestown. And it shows the breakdown of all turning movements for all vehicles. In this case, full length, so about 3 to 4 days of data is accrued in this image. And in addition to that, it also shows you the pedestrian activity. So the crossing points here at all four sides here do give a breakdown on active transportation users, as well as, so you can see here on the edges, there'll be a breakdown. So 19 pedestrians, 14 pedestrians, 29 pedestrians, 32 pedestrians. That's what the image is communicating there. And this comes from the camera data. So I'd like to talk about our strategies. So strategies for reducing congestion and improving highway operations. So I'm going to go through a few slides that talk about a few of those. So the Rawhide Bridge and intersection realignment strategy. This image indicates where that would take place here in Jamestown. And overall, this did very well in both existing and future conditions in the modeling. And several performance indicators show that this was a decent strategy, and it performed very well in terms of improving the operations. The Greenlee extension, which we talked a little bit about earlier, also did pretty well in both micro and macro simulation. So the image, of course, on the left shows you where it would go in general, the location for that extension. And the image on the right shows a turning movement breakdown, a volume breakdown, and this is based on the 2040 TransCAD model that we worked with project initiation and forecasting here at Caltrans. They helped us out putting together the analysis for the TransCAD modeling. And all this image shows here is what the potential turning movement breakdown would be with the Greenlee extension and meeting up with SR 49 north of downtown Sonora. This shows the Mackey Ranch Roundabout project close to the Chicken Ranch Rancheria. And in model simulation, this scenario didn't do well. However, it may have benefits in terms of safety enhancements for active transportation users. If the purpose is to slow down traffic, then the roundabout may be something that would work. I believe this is going to go into construction anyway. And the tribe did submit feedback, and we intend to include that in the final study, indicating the results that they found, which showed a better performance from this roundabout. So we have received their feedback, and we do plan to put that into the final study.
I've got a question on that. What is the assumption on speed limits between that roundabout and Jamestown? I mean, you're going to slow traffic down. Are you going to then speed it back up again and then slow it back down, or are we going to lower the speed limits between that roundabout and Jamestown?
Well, I think the way we looked at it in the model, we did model a speed reduction going into the roundabout. The program allows us to do that, and we reflected that in the program. So, yeah, there's that may have played an influence in the modeling results, but yeah, we did make the decision to reduce speeds for vehicles going into the roundabout. Between the roundabout and Jamestown, speeds were pretty much what posted speeds are or free flow speeds are. So between the roundabout and Jamestown, we didn't make any adjustments or changes to vehicle speeds beyond what we think vehicles do out there every day.
Yeah, let me jump in too and just give it a little bit different perspective. One is from the planning perspective that Charles is talking about.
No.
The other is compliant with the law. Caltrans will do additional speed surveys. If there's a reduction in the 85th percentile, I think we can expect to see a change in the speed limits. There is a requirement in the law also that you recognize significant changes on the highway. So they can't just kind of roll the existing speed limit forward. They have to do a new speed survey. When
Right
the time is
now,
appropriate.
it's 55 miles an hour all the way to the whistle stop there coming into town. Okay, not the whistle stop, but the
Hills area.
Yeah, the Rolling Hills area, basically. If we're going to slow traffic down, and I'm not an advocate of lowering speed limits, don't get me wrong, okay? But if we're going to slow traffic down for the roundabout, then we're going to speed them right back up to 55 miles an hour. That doesn't make much sense to me for the short period of time that it's there. And just a comment, we need to think about that.
Okay. Go ahead and continue, Charles.
All right. Moving on to the other roundabout location. This is at Columbia Way near Sonora High School. And in the modeling, the roundabout did not reduce delay and congestion or queuing. But again, roundabouts can be safety enhancers. They can reduce the speed of vehicles, especially in built environments. So I think this is something to look into more. And paired with the Greenlee extension, the Greenlee extension would act as a bypass around downtown. And that would take about 11% of volume out of downtown Sonora onto the Greenway extension. That's what we found from the modeling that we did. So this roundabout, I think, it is a possibility if paired with the Greenway extension. And again, roundabouts have shown that they can be safety. They do have safety benefits for certainly in terms of reduction of certain types of vehicle collisions, but also for pedestrians and cyclists. The five-lane widening strategy. This is an image taken from near the Jamestown area. So we got Rawhide over here. We have Fifth Avenue up here. Overall, this strategy did really well in both 2018 and 2040 conditions. It was one of the best performing scenarios we ran. And this is the signal adjustment strategy at Rawhide and Fifth Avenue. So we worked with both signals to see what could be done in terms of reducing delay and queuing on the state highway. And this shows us the results from the 2040 conditions. And what the table shows is that in 2040, the signal timing themselves will not do much to reduce delay or congestion in 2040. But the signal timing adjustments and coordination paired with the Rawhide bridge realignment and with the lane widening do show effectiveness. They do show some degree of improvement, especially when considering the lane widening along with the bridge realignment and the intersection realignment. We did see noticeable improvement of the level of service and a delay drop, a substantial delay drop from what would be the unbuilt, unchanged 2040 conditions. Existing conditions without the Greenlee extension. So this is from our macro model, and this shows what things are like according to, I think this is 2018 TransCAD data that we worked with here. And you can see here in downtown Sonora, we have about 19,000 in volume, in vehicle volume here under existing conditions. But with the Greenlee extension, that there is a change. So on the right here, you see it may be hard to see here on the image, but that 19,000 in volume drops to about 16,430. So that's about an 11 to 12% reduction in volume in downtown after the Greenlee extension was put into the model. Now the image on the left shows what happens if there's also a western bypass. So you can see all the way out here. And again, the exact location of this is not determined. But we did also include a western bypass, and the reduction in volume to that was minimal. It was about it was less than 1%. Key thing to note, when we ran the 2040 conditions with the Greenlee extension, when we ran the western bypass models, those models were used using the assumption that the Greenlee extension was already going to be in the model. So the Greenlee extension itself made about an 11 to 12% reduction in downtown. The Greenlee extension plus the western bypass added an additional maybe 0.8% reduction in overall volume in downtown Sonora. So as I said earlier, it's the western bypass options are they have minimal effect on volume in downtown. We had two general possible routes for a western bypass, one of which we ran down to Bell Mooney, and another one which we ran over to Montezuma Junction. And you can see that for the both of them, their effects on volume in downtown Sonora were fairly slight. The Greenlee extension was the one that made the most difference. So at this point, we're going to look at active transportation strategies. So we also looked at strategies for pedestrians and cyclists. Looking at this map here on the left, we have a depiction of crosswalks. So the orange the orange indicates existing crosswalks, and the green, it would indicate proposed crosswalks. And a lot of these proposals do come from Vision Sonora. And also we do propose new crosswalks in the Jamestown area, particularly at the Rawhide and Fifth Avenue intersections. And the image on the right, that is from Vision Sonora, but that does give an example of what the crosswalks might look like. We didn't dive into specifics on the geometries or the exact locations of the crosswalks, but we did give a general feel on whether they cross the state highway or if they are adjacent to the state highway. That we did try to show on the map. Sidewalk strategies. So this indicates what would happen if we installed more sidewalks. So the purple indicates new sidewalks. The light green also indicates new sidewalks, specifically from the 10849 split up to about post mile 17.15, just south of the fairgrounds entrance. We are looking at advocating for sidewalks in the Jamestown area and also pretty much in incorporated Sonora, so all the way up to Preston Place. We are examining putting in new sidewalks, and that does meet a gap need. ADA strategies. So this shows where we would put new ADA curb ramps, Jamestown included. So again, pretty much following incorporated city limits and the built environment of Jamestown. This is where, these are all the intersections where we would look to improve ADA curb ramp conditions. Active transportation pathway. And TCTC's multimodal corridor plan also examined a similar strategy to this one. And in general, we're looking at wanting to do something that's parallel or adjacent to the state highway. And maybe in most areas, there are some places this pathway may go and use local roads. Certainly up here in this area, we would look at using this local pathway. And overall, in 2040 modeling conditions, this scenario did show some improvement in highway operations when we took out about 0.5% of single occupancy vehicle volume in 2040 conditions, 0.5% going toward pedestrian and then 0.5% going toward bicyclists. So it did show some improvement in delay and congestion. The tables on the left. This table shows the data that we collected from our cameras for bicyclists and pedestrians. So every location we put up a camera, we found pedestrians and bicyclists along the state highway, especially in Stockton, Washington, also near the high school. Every location, we have active transportation users along the state highway. This table on the bottom is from Census Transportation Planning Products, which comes from the American Community Survey, and this indicates that we have people reporting using walking and cycling as part of their commute. So it's the totals are down here, about 6.3% pedestrian activity and also about 0.5% of cycling activity. So it does indicate that there is a need to meet the needs of active transportation users along the state highway. This is our paved shoulder widening strategy. So the thick blue line does indicate where we think a widening of paved shoulders would need to go. So we're looking at 8-foot paved shoulder widenings on both sides with edge line striping on both sides. And we didn't get into geology or slopes. We didn't examine the limitations of that. We strictly wanted to look at what the needs are and what the possible improvements could be. But this is something to look into further, and this would be an enhancement to. It would be a reduction of bicyclist level of stress, and having those edge line striping on both sides would also help cyclists know where the shoulder ends. And this basically indicates the timeline of all of our strategies. And this timeline comes from the 2016 RTP. So we tried to base this timeline strategy from the RTP, and it goes through all strategies. Some are short term, such as signal timing and coordination. That could be a short term. That could be an improvement that happens rather quickly. Some are midterm, some are long term, and some are hypothetical, or at least they're tier 3, location yet to be determined. So the western bypasses, we class those as hypothetical. And that is it. That is the presentation. Thank you so much.
So just thank you. A lot of detail there, a lot to absorb. But I do have a question about the signal timing in Jamestown. As your study went, do you believe that it would be beneficial to try to address some of that signal timing at this time? That's either Darren or...
Let me take that. I've been working with Carl, and Carl's had a lot of communication with the district director and his team, which doesn't necessarily include Charles. He's been involved peripherally, but we've made a lot of changes out there. I think it's gotten a lot better. It doesn't mean it's perfect. I think it's doing about as well as we can given the lane configurations. But Caltrans has done even more updates more recently, post-COVID impacts, and made more adjustments. They're doing their darndest. I'll say that.
I flew through this morning.
Yeah, I've done a lot of just personal sit there and watch, traffic patterns and stuff. Plus, Caltrans has done, I don't know how many times they've done studies down there for me. I thank them for that. It's a difficult problem. It's not, there's predictable times when it gets congested, obviously the morning commute and the afternoon commute. But there's a lot of unpredictable occurrences that happen down there. And it's difficult. It's a difficult problem to solve because it's a two-way problem. It's not like everybody's going down the hill in the morning and everybody's coming up the hill in the afternoon. We have people going both ways both times. So if you sync them going one way, they're out of sync going the other way. So it's not an easy problem to solve. I'm convinced that I'll continue to work with Caltrans as the need arises. I think we've got it fairly well under control right now, but we're really not going to know a real answer until we get that Rawhide Bridge program in place, because that's going to shift the one intersection about 100. I think it's 100 feet, something like that. So we're basically doing a Band-Aid approach now, waiting for that project to complete itself, and then we'll look at what the long-term solution is. One of the things that concerns Caltrans right now that will hopefully go away is they really can't let traffic back up on Rawhide Road very much because of the one-way nature of that bridge, and it becomes gridlocked, and then we've got a real problem. So they're going to have a lot more freedom to maneuver once the Rawhide Bridge project is completed. So with regard to that, they can hold up traffic on Rawhide a little bit longer if the commuter traffic's on 10849 calls for it. So, and we're also, just for the public's information, we're very actively working. Our Public Works Director's staff, Roads Division, is very actively working some additional stop signs in downtown Jamestown because of the detours that people are taking to avoid the congestion on 108 and 49. So hopefully we'll slow down traffic there as well.
Madam Chair, I don't know if you want to indulge more questions at this point. I just want to give you kind of where we're going here. And I do appreciate Caltrans being comprehensive. I know it's taken a lot of your time, which is very unusual. Comparing this to East Sonora Bypass, where we spent at this point about $130 million, this is the beginning of another major investment effort over the next couple decades. So it's important that we be comprehensive, but I do apologize for the time it's taken. We do have one more portion of this where we would talk a little bit about the complete streets elements from Wood Rogers. We've asked them to be brief. If that's okay with you, we can continue on to that. But I'm willing to.
I'm going to look across the dais if anyone needs a break at this point. We've been sitting here for some time, or because I don't want to rush you. I'm just going to say let's take a 10-minute break, and we'll come back.
That's why you're the chair.
Yes, thank you. For the slight delay, Mr. Rossi.
Okay, thank you very much. So we're going to go over to, I think it's Derek Kirkland on the line. He's going to give us a presentation on this complete streets element of this project. Then I'll just have some concluding comments and take any final input the board has. Derek, go ahead.
Good afternoon. This is Derek Kirkland with Wood Rogers. We've been helping TCTC with the SR49 corridor plan. And I guess what makes this a little different from Caltrans is our focus was mainly on adding the multimodal components to the corridor and looking specifically at alternatives analysis and some different things that we looked at in addition to their corridor study as well. So I'll kind of get through some of this stuff you've already heard, kind of the corridor background. Again, our study goals were to reduce congestion, increase mobility for travelers, increase transportation choice, provide multimodal connectivity, and ultimately improve the air quality. Study area was basically Jamestown through the city of Sonora all the way up to Columbia College. The first thing we kind of looked at was, as we started this project, was the existing multimodal network. One of the things we noted in here was really that there wasn't a whole lot of pedestrian connectivity, especially between the towns. We observed quite a few people walking along basically dirt paths along 49, and just a lot of disconnection between a lot of the transit stops and pedestrian paths and just how people were moving around. Within the towns, we also noted quite a few gaps in the sidewalk network. A lot of ADA challenges just with sections of older sidewalk, especially intersections, just not up to current standards. A lot of safety concerns just with how everything was kind of laid out. And so that was kind of our focus with this plan, is really to connect the towns, but also kind of start to fill in some gaps as well. The other thing we focused our attention on was the distinctive communities land use. And basically that's where connecting the different towns and those distinctive communities was a really important aspect of our plan. And so one of the things I'll get into here in a minute is really looking at a shared use path, and getting that bike and pedestrian connectivity between these distinctive communities is where we saw a lot of benefit in terms of the congested corridors performance measures. As we started the plan, it took some time to coordinate with Caltrans report and meet with some different stakeholders. And so and as we went through the plan, there was also some changes just in terms of some of the guidelines we're continuing to change with the congested corridors plan. And so a lot of that played into our plan. And so at the beginning of this year, a lot of that stuff started to settle down, and we were finally able to get through a lot of the preferred alternatives, which I'm going to get into next. Stakeholders, we've worked with Caltrans quite a bit. We've worked with the city of Sonora. We've worked with the Columbia College and the high school. We've also worked with a number of private stakeholders as well in the area just to try to figure out and get their opinion in terms of some of these improvements. So moving on to the alternatives approach. So one of the things that we did was we really looked at, class 1 facilities was really what we were focused on in terms of can we make it work? What's the feasibility of it? And then from there, we went down to looking at connecting facilities, class 2 and class 3 facilities. We looked at pedestrian opportunities in terms of sidewalk and connecting gaps. We looked at transit and park and ride opportunities, focused mainly on where we could put park and ride lots. And then we also looked at some technology options, and then just incorporating a lot of these complete streets improvements into Caltrans' proposed street widening projects. So in terms of the class 1 facilities and class 2 facilities, those are your biggest bang for your buck in terms of they give people the most level of comfort, but they also have a more increased investment to them, where your class 3 facilities are more your sharrows and it's just more of a bike route. And so we try to focus more on the class 1 and class 2 facilities for this project. So going through the alternatives analysis, so we looked at several different alternatives. Alternative A was primarily, looking at a shared use path along the highway, along an existing transportation corridor. And alternative B was focused on kind of off-highway alignment that had been discussed over the years. And so we looked at the feasibility of that. And then we also looked at another opportunity, which is noted as the rails with trails option, to see if there was an opportunity there as well. And same thing for the north portion of the corridor. It's just the A alignment follows more of the highway, and the B alignment kind of varies from the highway. And as we went through some of the evaluation criteria we looked at were user experience, overall connectivity, who's going to use the path. We looked at potential environmental impacts. We looked at constructability issues, and we looked at some high-level costs, some planning-level costs in order to determine which alignment may be the more viable option. And we did come up with alternative A as the most probable in terms of a shared use path. A lot of that being it's where people are, it's where they're going, it's an existing transportation corridor. It has the most direct connectivity between the towns. Since it is since it is a existing highway corridor, it has less potential for environmental impacts because it's already been disturbed. And there are some constructability issues, but overall, we found ways that could be mitigated. Some of the other opportunities we looked at, so the bicycle, you can see the green line here is basically the kind of that preferred shared use path alignment. There are a couple sections where we did add another link that was off the highway network, mainly because it was picking up some communities, or in the case of the Dragoon Gulch Trail, and that made the most sense because it provided better connectivity to the high school, and also was the only viable option to kind of get through the Sonora area and still meet some of the design criteria for a shared use path. But in terms of connectivity to the city of Sonora and downtown Sonora, we also looked at class 2 bike facilities to connect back to the shared use path from there. Pedestrian facilities, one nice thing about the shared use path is it covers both, provides an opportunity for both bicyclists and pedestrians. And so you get quite a bit of cost savings in a lot of these areas because we wouldn't necessarily have to build multiple facilities. The shared use path could cover both users and help save costs as the projects were implemented. But we did add some sections where we would have sidewalk and some other sections in Jamestown where we'll be filling in some gaps and also looking at ADA improvements. Moving on to transit, one of the recommendations was was really looking at park and ride lots, a park and ride lot down in Jamestown, park and ride lot up towards the Paris Ferry Road, And then also the transit center to the east of Sonora, and then there's already a number of parking areas within Sonora. But kind of formalizing those as park and ride lots, and encouraging people to, take the shared use path, take transit, and better connect kind of all those multimodal opportunities. Oops, sorry about that. In addition to that, we looked at some technology opportunities. One thing with the parking we noticed was there are some parking areas, but it's hard to tell, how many parking spots or where I should go to park if I was a visitor coming in. And so one thing that would help, especially to get people to use the park and ride lots outside of town and take transit in, would be real-time travel and parking information, letting people know that there are parking spaces available, park and ride lots and less parking available in downtown Sonora, and promote kind of that visitor transit experience as part of that. ITS improvements, and also one of the other things we looked at, especially with the shared use path coming on, electric bicycles and scooters start to become a lot more viable. They have a place separated from the highway, and we're seeing a huge popularity in electric bicycles, especially on these new paths that are being built. So this gives you an idea in terms of the complete streets of how we're incorporating that. Where we have constrained areas, especially to the north here. We looked at mainly incorporating the shared use path with the street section and using some sort of barrier to separate it. Helps give people that level of comfort, but then keeps that path within the highway corridor, which makes constructability a lot more feasible. In areas where there's projects for widening along 49 and 108, we've looked at incorporating obviously the shared use path on one side and possibly a sidewalk on the other. So that, again, keeps you from building multiple facilities and kind of makes these widening projects more of a complete street improvement, and also helps in terms of the performance measures with the congested corridors program by adding these elements to these widening projects. Moving on, the other thing we talked about in the plan, we will have an implementation portion in the plan. We've started to organize some of these projects into short-term, medium-term, and long-term. And a lot of that is just geared around towards the priorities and where their projects are already moving in terms of what Caltrans already has on their plate. So a lot of the stuff in Jamestown is already moving forward, and so a lot of that would be short-term. And then there's also the Dragoon Gulch area that's had a significant amount of effort put into it. And so we started focusing our efforts on looking at a kind of a first phase of the shared use path that would connect the fairgrounds up to Dragoon Gulch and back towards the high school. So that'll be part of the plan. And then we've also got some collaborative efforts that with the rails, with trails, there is an opportunity there that should be explored. And obviously the Vision Sonora plan, and looking to work with those projects and incorporate some of this. So where we're at in the plan is similar to Caltrans mentioned, is we've got a good draft of the plan. We're soliciting public comments, and then we're going to be in the public comment period. I believe, and Tyler could touch on this, is going to be extended to September 21st. And then we'll be finalizing the document, and we've already submitted an ATP application for some priority segments, which I'll talk about briefly. So the priority segment in terms of the shared use path is really, as I mentioned, from the fairgrounds, along 49 to the fairgrounds, up to the Dragoon Gulch connector, and then into towards the high school. So we had applied for ATP for that. And one of the reasons is that is a priority segment, is there's already a fair amount of trails up there. And the area on the highway near the fairgrounds was one of the higher segments for pedestrian fatalities. And so this will give us a good idea, allow us to improve some of the intersection there, and provide some connectivity between the fairgrounds, a commercial corridor in that area, between the residential area, the park and recreation, then also to the high school. So it provides a lot of connectivity and be a great kind of demonstration project as to what the shared use path could look like in the whole corridor. So with that, I'll wrap up my presentation and turn it back to Tyler, and we'll be happy to answer any questions that you have.
Thank you, Derek. Carl, did you have a comment?
No, I've got a question. Well, it is sort of a comment too. I'm all for the college and all of that. My question is why, when we talk about all of this, why do we never talk about extending it out to the park in Columbia? There's that whole segment along Parrots Ferry. I'll tell you what, if I live to be 85 or 90, my guess is I'm going to hit somebody on Parrots Ferry at night, walking along the side of the road in dark clothing. And I think it's really underestimated the amount of pedestrian traffic that runs between Sawmill Flat and the park, and it's a lot. You've got an elementary school there in that area. You've got a post office. You've got several commercial, a pizzeria, a diner, a gas station, all manner of commercial activity there. Why don't we talk about complete streets all the way to the park?
Carl, I think we are, but just under a different effort. We have the active transportation plan that's coming. I think it's been presented to this board. It looks at more communities.
Okay.
The focus of this was a certain corridor.
Okay.
But that doesn't mean that we aren't interested in doing projects within Columbia, other projects in which we've submitted applications for funding for as well. I point out on Parrots Ferry Road, unfortunately, they didn't get funded. We have Tuolumne, many other communities have needs that we've addressed through the ATP, which is a more broad effort.
Yeah, I think my point is that, and again, I don't want to minimize the value of the college and the need to address their needs as well. I fully support that. But we have, in the lower part of the county, we have, when you look at the visitorship, when you look at our own people moving about, we have three main hubs, okay, on the lower part of this county, and that's Jamestown, Sonora, and Columbia. And then, of course, you got the ones up the hill. But my point is you know, I made my point. Enough.
I fully understand it, and you've kind of given me an opportunity to bring up something, and that I want to touch on briefly is funding this. I mentioned many programs that we want to tap into for this corridor study that mainly are derived through Caltrans funding sources, but our traffic impact fee program is up for a major update. It's long in the tooth. It was adopted back in about 1998. And now it needs to be updated and be consistent with current SB 743 requirements for reducing VMT. So I think you'll see staff coming forward with proposals to update the project list and begin to implement or incorporate pedestrian walkway safety projects within communities to support some of that infill development and the desire in the community for more walkable communities. So that's another avenue we're going to go in that hopefully when the time comes you'll be there to support us on.
Okay.
And then finally, I just wanted to go ahead and say that we aren't just sitting idly by. We are moving forward. Derek mentioned the ATP applications that we have. They'll be submitted today is our deadline, actually. We're making final adjustments to that. But also, we did get a project study report completed for the widening project in Jamestown to bring it out to 5 lanes. They're going to incorporate all these complete street elements to it on the 49 corridor, going from roughly east side of Sierra Motors, east of 5th Avenue, out to about Harvard Mine Road to the west, just past Main Street, Jamestown. That's looking like about a $20 million project in total. Going to take somewhere in the range of 7 to 10 years to build. We want to get right into the environmental document, as well as some of the preliminary engineering. That's $1.6 million. This board has supported using some of our regional funds to get into the environmental document to keep the momentum going on that project. But we do have to work towards how we're going to fund the other $18 million. We're working with Caltrans on that. I think the TCTC and others will see us with a major proposal on funding that project here in the coming months. So just to recap, we do have one final public input opportunity. It's the City Council on September 21st, and that is the last day for public comment before we finalize these documents. These documents can all be found on the Tuolumne County Transportation Council's website.
I want to go to public comment, unless there are any more board questions. I'm sure there are some board comments on this.
It's important. I think Darren really hit on it, that we have to plan. And these particular documents are ones that we really need in place in order to move forward, especially for the rest of the board members that are going to be here and I'm not, so.
Yeah, and I had a similar comment. I mean, this can be dry material, talking about traffic patterns and multimodal connectivity and active transportation plans, but this is incredibly important stuff. This is what our county is actually going to look like. It's going to define what your commute to work is going to look like. Commercial traffic in and out of the county is going to be affected by this. I think positively. I think you have a very good plan here. But you mentioned the September 21st is the last opportunity for public comment. I sincerely hope that members of the community might be interested in this take advantage of that, because these things, the more public support that we have, the more public input, the more likely that they will be successful, because we're talking about a Jamestown widening, some improvements to the intersection of School Street and 49 out in front of the high school, some of these hiking and biking opportunities. We really appreciate the input that we've received from the public thus far, and I hope that people will avail themselves of that as we move along, because we really do. These have been in the hopper for quite some time, and we need to get moving on some of these projects. So,
Okay. At this time, I'd really, is there any public comment? There's no public comment? Okay. Anything else, Supervisor?
Again, I just echo Supervisor Campbell's comments. All of this is, and there's more, okay? But all of this stuff is incredibly important to the future of our county, and thank you very much for the presentations.
Anaya, do you have any comments?
No, I mean, ditto what the rest of the board said. Supervisor Campbell summarized it very well, so I'll just keep it short, and thank you guys for your presentation.
Thank you. Appreciate it, and I do hope that the public is paying attention and that they are really looking at this. And we'll provide any comments. Thank you very much, gentlemen. Okay. Heather, will you please read item 12?
Consideration of purchasing property in the Tuolumne area related to the construction of the Tuolumne Community Resilience Center.
Ms. Frank.
Good afternoon. Hi, Maureen Frank, County Administrator's Office. I'm here today before you for your consideration of purchasing of two sites out in the Tuolumne area for the construction of the Tuolumne Community Resiliency Center. Just a little bit of history so you know how we got to this point. As your board is aware, we did apply for, along with the state of California, for the National Disaster Resiliency Competition. And in that grant application, we were awarded funds for the construction of 2 community resiliency centers. Then in the spring of 2017, Tuolumne County engaged Lionakis Architects to work with us and the community in regards to developing a programming document. We really need to see what the building is, kind of like the blueprint. These buildings, what we wanted to contain in them, how big the parcel size was needed. From that programming document, we were able then to send out on December 31st, 2017, a solicitation for property. And in that, we had the criteria that we were looking for as far as the property and also the acreage that we would need. For the Tuolumne CRC, the county received 5 proposals, and then those proposals were ranked by the staff in regards to those criteria we sent out in the solicitation. The complete solicitation package was then prepared by county staff and then presented to your board for consideration. The direction staff got from that meeting was that to continue property due diligence on the 2 property and the 2 top sites. One of those was in Groveland and one in Tuolumne. The top site for Tuolumne was the ones that are before you for consideration. It is owned, these 2 parcels we're considering today are owned by the Tuolumne Band of Miwok Indians and is located on Bay Street and Cherry Loop Boulevard. The county is purchasing these 2 sites, areas consisting of 3 different parcels, though, just to make sure of that. The first parcel that we're considering will contain the parking lot area for the CRC, and the second site would contain the facility itself. The reason for the 2 sites is that the one parcel that will contain the CRC facility itself is not large enough to also contain the parking area needed for the CRC building. Also, we wanted to have, if you notice, the parking lot size for this CRC is quite large, and the reason for that is really threefold. One, we wanted to be able to make sure that these facilities had enough parking in order for us to be able to have multiple events occurring at the facility at one time. In Tuolumne County, we always are the biggest complaint we get with some of our facilities is there's never enough parking. And so that's one thing as we went forward and we worked with the architects on the design to make sure we had enough parking. The second reason is we wanted to make sure that, these facilities are not just for the day-to-day use, but they're also to be used during emergency purposes. So we wanted to make sure the parking lot had some emergency functions in them, was able for us, if we did have an emergency, that we could have emergency equipment staged there. We could do, if the health department needed to do vaccine clinics through there, we could set up tents, and if we needed to do some outdoor sheltering, we could do that. So the parking lot is big in order to handle those reasons. The other reason the parking lot area, that property is kind of big, is we wanted to be able to partner with the community. One of the things we heard is they have community events. They'll be able to use this parking lot for any of their events that are going on. So the properties before you that we're considering is roughly a little over 2 plus acres, and the environmental study was conducted on April 30th of 2019, and in which time your board approved a mitigated negative declaration for the property. A preliminary title report has also been pulled by staff and reviewed. There are no issues that arose from that report. A formal appraisal was done on this property by Right Appraisals, and it came in a value of $560,000. As a requirement of the grant funds, a preliminary acquisition notice was then sent out to the Miwok Band of Indians regarding the intent to sell. They signed this document and sent it back to us, and we followed up then with a formal sales agreement. The Tuolumne Band of Miwok Indians have been great supporters of this project all along. They've been participating originally in our focus group meetings that we had and our community groups. And they recognize the great benefits the CRC facilities will have for the community of Tuolumne, and have really worked with the county on the price of selling these two parcels. The price of the parking lot site was reduced with the acknowledgement of sharing the site for mutual benefit in the future. The Tuolumne Band of Miwok Indians and the county staff have agreed on a price of $303,333. Attached for your review and approval is the sales agreement for this property. As noted in the sales agreement, the county is also responsible for all closing costs and recording fees. An escrow has been opened at Yosemite Title Company. And again, just for, I know your board is aware of this, but just to emphasize, the money to pay for these properties are coming from the National Disaster Resiliency Competition Fund. And the attached sales agreement has been reviewed by County Council. And as staff, I'm here to answer any questions you may have.
Thank you, Mo.
You're welcome.
Looking to see if there's any questions.
No, just
comments.
thank you, finally.
It is.
Is there any public comment? There is none.
I do have a comment or a question.
Okay.
Hey, Mo, just came to mind. With the actual grading of the parking spaces, is when we go to create that parking space, is that also covered by the resiliency grant?
I didn't understand.
Supervisor Kirk, could you please restate that with a little more emphasis on your voice?
Yes, so we're purchasing the property, but will the grant also cover the creation of the parking lot, the building creation of the parking lot?
Absolutely. The grant will cover all costs related to the community resiliency project.
Great, thank you.
You're welcome.
I just had one question. How are we doing on time for completing the projects within the NDRC deadline?
Your staff is on top of it. We are currently right now finishing up the plans and specs. We will, before you in October, we'll have a third-party plan review firm to be able to review those plans and specs and certify them. In January, the plans and specs will be out to bid, with then construction starting in April, with a 14-month window construction cycle, which will put us in at June 2022, right on schedule.
Okay, fantastic.
And I know the state is still working on a amendment to the NDRC grant. Besides the 13 states, counties, districts, cities that are part of this grant application, there were also 3 states, New York, Connecticut, and New Jersey, that were part of Hurricane Sandy that started the whole ball rolling with NDRC. None of us are all of us, let me say, are asking for a time extension on this, but we're not, that staff is geared towards finishing on time, June of 2022. It'd be nice if we had those extra extensions for other projects that are included in the NDRC grant application, but we will be done with our project.
Okay. Great, thank you.
You're welcome.
Right. So before I get an action here, I really do want to thank the Tuolumne Band of Miwok Indians. They have been tremendous partners on this. And I also want to remember and thank Evan Royce, who was, a advocate of trying to find the solution, along with Supervisor Gray. I think we're going to have 2 centers.
It's been a long time.
It's been a long time. And I know you 2 gentlemen put a tremendous amount of effort into finding a solution.
Staff did all the work.
A number of years ago. Okay. So with that, if there are no other comments, I'm looking for a motion.
I move in staff recommendations unless Anaya would like to do it.
No, that's fine. I'll second it. Thank you, Jen.
And is there any other board comment? All right, I've got a motion from Supervisor Gray.
Don't we need public comment?
Didn't I ask for public comment already?
Yeah, you did.
I did.
Oh, okay, I'm sorry.
Thank you. Just checking. Motion from Supervisor Gray, a second from Supervisor Kirk. Will you please do the roll call vote?
Supervisor Brennan?
Yes.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Gray?
Aye.
Supervisor Rotifer?
Aye.
Motion carries 5-0.
Thank you.
Thank you. Thank you, Mo. Okay. Will you please read item 13?
Consideration of approving correspondence in support of S4431, Emergency Wildfire and Public Safety Act, Feinstein, Danes.
Ms. Peterson.
Good morning, Madam Chair, members of the board. Liz Peterson with the County Administrator's Office. I'm here today requesting your board send a letter of support for the Senate Bill 4431, the Emergency Wildfire and Public Safety Act. This bill is being co-authored by, or co-sponsored rather, by Senator Feinstein and Senator Daines. Senator Feinstein sent a letter to Chair Brennan on September 1st requesting your board's support specifically for this piece of legislation. In the staff memo, there's an excerpt from her letter, but I would like to just read that if you would allow me. States the Emergency Wildfire and Public Safety Act, S4431, would provide federal agencies with critical new tools to reduce hazardous fuels, protect communities, and support forestry jobs, biomass development, and smarter energy practices. This bill is the result of extensive stakeholder engagement, outreach across party lines, and months of deliberations to ensure a truly bipartisan, pragmatic approach to reduce the risk of wildfire. So there are a lot of really exciting things in this piece of legislation, or a lot of things that are consistent with what your board has been advocating for many years. A couple of which I'll highlight. The bill would authorize the Forest Service to undertake 3 priority wildfire mitigation projects, so essentially large landscape fuel reduction type projects. Those projects would be 75,000 acres in size. The bill would also provide funding for those projects, and projects would be implemented in areas where, among other things, the project area was chosen through a strong collaborative process and where there is a likelihood of successful collaboration throughout implementation of the project. Projects would also be implemented in areas where there is a high likelihood that energy could be produced from woody biomass and small diameter trees. So I think it seems pretty obvious, I guess, to your board likely that we here in Tuolumne County, the Stanislaus National Forest would be a good location for one of those project areas, just because of the collaboration with the Yosemite Stanislaus Solutions, the master stewardship that the county has, master stewardship agreement, and then the existence of Ultra Power and other potential biomass facilities with the NDRC grant and others. So there's a lot of good items here in this legislation. There is a draft letter that I submitted to your board this morning. Hard copies are up on the dais, and then I emailed that to you as well. I do want to make mention of a particular item in the letter, the draft letter. When I was working with Chair Brennan on this, she mentioned that three projects of 75,000 acres is a good start, but it's nowhere near going to get us to what we need, especially when we see the fires that are burning currently, and the amount of fuel that is on the landscape. So the letter requests that we do more than 3 projects, or that the legislation approve more than 3 projects.
I want to add to that real briefly.
Go ahead. Yep.
Because I had a number of conversations with Senator Feinstein's staff, and they reminded me that there will be a companion piece of this moving through Congress. And so what's not on here is the CCs, and I want it to have an effort with Congress because they could look for some amendments and request more sites. When we talk about 3 sites across the western United States and the magnitude of the problem, that I think that her proposal is absolutely what we need. We just need to see it expanded. And so we'll be working with our congressman and the chair of the Congressional Natural Resource Committee and really trying to advocate for more than 3 sites. We made the case in this letter that we would have 3 sites just on the Stanislaus National Forest that would be excellent applicants for that. And so when you look across the western United States, we've got to figure out a different metric and increase the pace and scale. The other piece of this that we did not comment on is she also has the 3,000-acre CE component in that, and it is much like what was in the Farm Bill. And we have had conversations around that because it really is geared towards fuel breaks, roads, infrastructure. The challenge with that as it currently exists is they cannot be contiguous. And so we end up with a patchwork in these areas that become very problematic because they haven't had treatments. And so that will be another piece that we'll kind of be really trying to focus in on, is because when we're looking at field breaks, we know that they've got to be really contiguous. They've got to be there's got to be connectivity if we're going to, again, really change some of this fire behavior. So that piece was not incorporated in this letter, but it is another piece that we do want to be working, on the companion side of it as it moves through Congress.
It's important. Liz and I had a discussion this morning on a really good project, I believe, on the Stanislaus that this would fit into and really do a lot of good. But it's in her hands now.
Yeah, I think I applaud Senator Feinstein and her staff and everybody that is engaged in this bipartisan effort. It really is a long time coming. It's yes, it's one small step, but you don't get to any destination without taking that first step. So as long as we recognize that it is just a first step on the way to a very important, worthwhile public safety goal of making our western lands, and especially our forest lands, fire safe or fire resistant in terms of not having the huge kind of conflagrations that we've got right now. I support this wholeheartedly. Again, it's a very important first step, and we will continue to work. I will continue to work through NACO and through CSAC to support any and all of these activities as long as I'm sitting on the board. So I'm all for it.
I interrupted you just
No,
on that one piece, and did you have?
I have nothing further to add. Yeah, I think, I guess, suppose I will add just one piece, that this would be just with what the Forest Service is already working on with their Cerro project and a little over 100,000 acres, well, a little less than 100,000 acres of forested of national forest land that would be under a NEPA type analysis. And then with this, if we could, if this project could be added to the Stanislaus as well, it would be a significant effort towards your board's goals.
And I think it's important, again, to note that the primary reason that we feel like we should be and probably would be very competitive in this kind of a thing is because we have a very strong collaborative.
That's right.
That has already demonstrated their ability to collaborate on very important and projects with this regard. So it would be remiss to not mention YSS and how important they are to getting to that final solution over time. So again, thanks.
Mm-hmm. Absolutely. And I just will note that there are other components of this that are equally important. There's an education component, a workforce component, and as we bring up in the letter, when we have some continuity going forward, private industry will be more willing to make investments in infrastructure also, and there is infrastructure that is needed with regards to transportation and some of the other components of getting our force healthy again. So if any other questions? Supervisor Kirk?
Just ditto what the rest of the board said. I know it's hard to hear me via phone, but there's section 103 on this attachment that talks about wildfire risk reduction activities near existing roads. And yeah, there's just such a need. They say 90% of these wildfires start within a half a mile of a U.S. Forest Service road. So there's so many little pieces and components that need so much attention if we're really going to mitigate fires in the future. But like Carl said, this is a good first step, and hopefully with all our collaborative efforts with YSS and master stewardship and all those things, hopefully we'll be a good fit for these projects. And just thank you, Sherry and Carl and John Gray, all you guys who've been on this board and been a part of these processes in the past. It's hopefully this will pay off with this project moving forward. Thanks.
Okay. Is there any public comment? Bring it back.
I'll move on approving the chair to sign the letter to Senator Feinstein.
With the addition of a CC list.
With the addition of a CC list.
Second.
I have a motion from Supervisor Rotifer, a second from Supervisor Gray. Please do the roll call.
Supervisor Brennan?
Aye.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Gray?
Aye.
Supervisor Rotifer?
Aye.
Motion carries 5-0. Thank you very much. All right. At this time, let's do item 16, and then we will come back after lunch and do our closed sessions.
Absolutely. Item 16, Supervisor Kirk, consideration of developing a board committee on COVID-19.
All right, just give me a second to set up. Okay, well, can you hear me clearly, Heather? Yes. Okay. Well, as we discussed at the last board meeting, I presented this to the board, and what I took away from that was we wanted a little bit more clarification what the actual working group would look. So since that meeting, I took into consideration what some of the supervisors had stated. And if you go to, let me click on it. I only have one screen in front of me. If you go to the agenda and you actually look at the committee that I am proposing, let me click on it. At the last board meeting, I wanted to have nothing but private doctors, private nurses, epidemiologists, nobody from the government side of things. However, after hearing the rest of the board's concerns, I wanted to speak to that. And so if you look at the membership, I did note 2 board members, most likely be Carl Rotifer and myself. And then the epidemiologist, I know that since the last board meeting, we now have a new public health officer, Dr. Surjenko. And so in order to satisfy the majority of the board's requests, I am open to allowing or proposing that we allow Dr. Surjenko to be part of the group. I think with what he has going on with the Yosemite Working Group, he'll bring a plethora of information to this working group, and also I think moving forward, I'm more pleased to be working with Dr. Surjenko moving forward. So anyways, that's kind of just the layout of the membership. The supervisors, epidemiologists, possibly Dr. Surjenko, the medical doctors, a private nurse, private family counselor, private child counselor, psychologist, and public health director. Again, hearing some of the board's concerns about being a team and not excluding anybody from government, I'm open to having the Tuolumne County Public Health Director as part of the conversation moving forward. I think that'd be important. So let me get back to my memo, and I'll just read it, and we can discuss it after that. But Basically, as you all know, the WHO model that was predicted back in February, March, said that Tuolumne County would have about 5,000 infected, around 500 hospitalized, around 100 to 150 dead by mid-May. The current number, and this is as of yesterday, is we have 213 cases, 187 have recovered, 9 are currently active, 1's in the hospital, and there are 3 deaths. One of those deaths did have underlying health conditions. And as we all know, at the beginning of all this, the shelter in place and the shutdown was to give surge capacity to our hospitals so they could deal with COVID patients. It was never put in place to defeat COVID-19 or wait for a vaccine. As Dr. Surjenko said this morning, hospitalization ICU rates are on a downward trend. They've been on a downward trend. I believe he said between 10 and 20%. Was the average, and Calvert County, I think, was at 40%. I did not hear what Tuolumne County was at, but that was just an average. As Supervisor Rodefer stated this morning, there's a lot more public health issues that I feel like aren't being addressed. And so, in the grand scheme of things, when we look at CDC, only 6% of deaths have are directly related to COVID-19, and 94% of them had underlying health conditions. So when you look at the numbers throughout the nation, the death rate due to COVID-19, and this includes direct and indirect, so people who had underlying health conditions and people who died directly from COVID-19, in the United States, it's 0.060% of the population. For California, it's 0.036% of the population. And for Tuolumne County, it's 0.006%. As I stated, though, there's a much bigger public health issue that's going on, and so I just wanted to touch base on those locally with Tuolumne County. Prior to the shutdown, our unemployment was 4.5%. Now it's 14.5%. That's over a 300% increase in unemployment. The personal paycheck protection loans which went out saved around 4,452 jobs. Again, had those loans not gone out, on paper, it looks like we could have been looking at a 37% unemployment rate. Johns Hopkins Bloomberg School of Public Health shows that there's a 300% increase in mental health issues nationwide. And just a few other statistics, the Prevent Cancer Foundation found that 35% of Americans have missed routine cancer screenings due to the fear of contracting COVID, and 43% have missed medical appointments. Now, these are just a very small summary. There's pages and pages I could have included. I just wanted to kind of make a point of how COVID death is so far buried under the 0.06036 and 0.006 percentage, while we have astronomical increases in so many other areas of public health going through the roof 300-fold. So since the last board meeting, Supervisor Rodefer and myself, we met with some local doctors, nurses, and a licensed family counselor. And so I listed in this report just a quick summary of that discussion. Again, this is just a quick summary, but basically a lot of the data that is coming out is shaking the confidence of many of the doctors' review. Bruce, who called in this morning during the COVID-19 presentation, even alluded to some of the basically I'm not able to speak. Validity of some of the testing. And another doctor noted who works in the emergency room says that they are seeing, due to school closures and businesses and social isolation, they really see it affecting people's mental health and seemingly seeing an increase in drug and alcohol-related problems, especially an increase among teens with suicidal thoughts. A nurse who was part of this working group, who met with Carl and myself, works at an outside facility, not inside our county, but in the nearby county, and is seeing more suicide attempts, more suicides, and more suicide attempts than COVID hospitalizations. And I also noted, which was kind of interesting, just to the validity of testing and data. If you're pregnant and you go to a hospital and you're there to give birth, they're counting that as a COVID-19 hospitalization, which to me is a huge transparency issue. that's just one transparency issue with a number of others. But what was actually more striking to me than the doctors and the nurses was actually the family counselor who confirmed that domestic abuse, violence, divorce, fear, and anxiety are all up. And attached to this presentation is a summary of what this counselor is seeing. And it's pretty astonishing the effects that this shutdown is having on our society, but specifically on young children. And I was actually very surprised by what was presented. So also since the last board meeting, Supervisor Rotifer and I participated on a call with Dr. Mark Dowley, who was appointed Secretary of the California Health and Services by Governor Gavin Newsom. The purpose of the call was basically to share our concerns. It was us with a few other rural counties, our concerns with the tier system, with local density, rural counties versus urban counties. For instance, San Francisco. We live in San Francisco. Per square mile, they got about 18,000 people, whereas in Tuolumne County, you have about 24 people per square mile. So we just brought up little issues about how are these things being taken into account when you're reviewing data for COVID-19. But at the end of the day, I think our main request was that we really want local control. Nowhere in my proposal, nowhere in my memos, nowhere in my letters to the governors have I said that we just want to throw in the towel. We just simply want to have local control. Like Dr. Surjenko said, rural counties are different, and the data is different and needs to be evaluated in a different manner. So I'm hopeful that those conversations with Dr. Gawi in the rural counties lead us somewhere, but at the same time, if you look at Governor Newsom's public statements the last few weeks, let me bring it up here real quick. On August 28th, 2020, there's a press conference. The governor stated that he did not put up the green, and I'm talking about the tiered system, so green would mean we would go back to normal. He said he did not put up the green because we don't believe that there is a green light which says go back to the way things were. So the governor's come out and stated we're not ever going to go back to the way things were. Even with one case per 100,000 residents, the businesses are still limited to 50% capacity. So some of the doctors I spoke with, they don't understand how we're ever going to be below one case per 100,000 residents. So what that tells me is there's never going to be a time in the future where we are going to allow businesses be limited to more than 50% capacity. And so what I'm proposing to this board is, based on the conversation with Dr. Surjenko this morning, is to create this COVID-19 committee of local doctors, local nurses, family counselors, but also bring in some of the bureaucratic system, which would be Dr. Surjenko, the public health director, and continue to have conversations immediately. That way, as Supervisor Rotifer and myself continue to meet with the state, we can have accurate information, we can have shared information, and we can hopefully affect some change. I will tell you that moving forward, I'm going to continue to meet with this working group because I think 6 weeks from now, things could change because things are already happening so quick. But I think I'm going to continue to do this working group, continue to have these conversations with the state. But the reason why I want to move forward adamantly with creating this committee is because I think we have been doing this for 6 months. And Gavin Newsom also came out and said that
Anaya,
with the flu season.
Anaya?
Oh, I'm almost done. Done. Gavin Newsom came out and said with the flu season coming, he's looking at this as a twin-demic, basically saying that now we're going to be fighting off flu and COVID at the same time. So if I could also see this continue on for another 6 months, and I think we should move forward with the group. We should. That way, if COVID-19 and these issues continue to arise over the next 6 months, we'll have a working group and another piece in place to review data so our board can make informed decisions moving forward. So I'm open to any questions or suggestions or conversations.
Okay.
Got a question for Tracy. As I understand it, our contract with Dr. Sajenko is 20 hours a week as a public health officer.
Correct.
And looking at this list that Anaya's proposing, and Anaya, don't get me wrong, I understand what you're trying to do here, and I totally understand all the other conditions. I'm pretty well read on the issues that we face other than COVID. But what my concern is, and that's why I asked the question to Dr. Sajenko this morning, is where is the best bang for our buck? And if I'm going to make a decision, I ask an expert on an opinion on what we should do here. And it would seem to me that our efforts need to be put strongly on the political aspect of it, like you and Carl have already done, as far as with the state health officer and with RCRC and CSAC. So, with looking at the limitations of the hours that we are going to be spending with Dr. Sajenko, I don't see how he can be the epidemiologist on this particular committee. Now, as far as working with independent people in the community, I think that's fine. But I think from the standpoint of what we do here as a county and as a board, I'm going to be leaning towards the best advice that has been presented through the health officer that we have just hired. So, not against the concept, but I want to make sure that we're putting our funds in the direction that is going to give us the best representation. And I haven't been in on the Gateway Partners group as far as the number of meetings and how much push it's been from that group, but that's just my general feelings right now. And the other side is that we have committed to roughly $6 million or plus dollars of COVID funds to be spent within the county to help businesses and people. And I don't want to do something that's going to jeopardize that particular position at this time, because should and whether it's going to happen or not, I don't know. Should the state ever come back on counties that have set up their own rules that are different than what the state guidelines, I'm not sure if that's going to be a good thing.
Yeah. So I'd really like to give Supervisor Rutherford a chance to speak, because I did ask him to work on this too.
Sure. I want to address some things, and I'm sorry if I run on, but I think it's important. First of all, our COVID response, COVID-19 response, nationally, state, and local, started out with the assumptions and evidence, actually, of high transmissibility and high mortality rates. We started out knowing very little about how to treat symptomatically positive cases. So we started out trying to flatten the curve. We now know much more about how the disease is transmitted. We know much more about how to treat symptomatic positive cases. We have flattened the curves, both case mortality rates or case rates and mortality rates, and that's across the United States. Both are well below our initial assumptions, and Anaya talked about that. Mortality in particular is extremely far below what we envisioned. I talked earlier when Dr. Shurchenko was here about all the other aspects of public health that we really, I don't believe we're, at least in our dialogue, we're not factoring those in. We're not concerned with those, and I'm not going to list them again in the interest of time. I will say that in the beginning of this exercise, back in March or whenever we started, in the beginning, compliance was high. People got it. I supported our response. Now, due to a combination of cumulative response fatigue and eroding confidence in the validity of our response, public compliance is rapidly waning. We don't have the resources to enforce widespread non-compliance. And I think just from the sense that I'm getting walking around and talking to people in the community, that's going to become an increasingly difficult problem to solve. But beyond that, having a difficult problem to solve, we should ask ourselves a simple question. If the public is exercising widespread noncompliance, which we are beginning to get to, what does that say about their confidence in our decisions and mandates? Why do we not enjoy that confidence? We started out to flatten the curves, and we have. What is the desired end state now? And apparently the desired end state is we never go back to green. It cannot be to eradicate this disease. We have never accomplished that with any previous viruses. Okay, we have flu, we're still getting SARS cases every year, albeit low numbers. We have to learn how to live with this disease in the context of the conduct of our hopefully very near normal lives. We cannot continue to advocate chasing moving goalposts, and our total public health and the normal development of our children demand that. Now, having said all of that, and I say that to give a framework on what I'm going to say next, I think that the best way to deal with this, and I'm going to recommend that, and there's another issue that I'm going to have to deal with on that, but it looks like I'm going to be working with the CSAC group. I assume that Supervisor Brennan is very active with the RCRC folks. I would like to get plugged in to the weekly, Gateway Partners call, so I can make input and hear what's going on, so that we're, as I mentioned to Dr. Surjenko, I think it's important that we at least sing in harmony, okay, as a county and as a region. I would recommend that. I would recommend also, I would not recommend that we form another formal advisory group to the board. I think that I can continue to work with a private committee that we've had. I think that's a very important thing. I got a lot out of those meetings, but I think our staff, both the public health staff and certainly Dr. Surjenko, are more than gainfully employed right now, and I'm not necessarily interested in adding workload to them. I think that we can carry the message back and forth to the board and back and forth to the partnership and with our associations. So that would be my recommendation. It's two-part, three-part. And I continue to work with our our citizen advisory group, and my military jumped in there, and that I get a little bit more plugged into the Gateway Partnership, and that Sherry and I continue to pursue the recognition that, in a rural community, it's not like we live in San Francisco where there's 17 or 18,000 people per square mile. We have 24 people per square mile in Sonora. Now, yeah, there's some concentrated areas, but it's still different. And so that would be my recommendation, Madam Chair.
Okay, thank you. I'm going to go to Supervisor Campbell in just a second. And I agree with the majority of what you said. We may have to work on the Yosemite Gateway piece because there's only one supervisor from each county participating, but let me work on that a little bit and see where we can get to, and it may be a shared participation or something, so depending on what.
Maybe I would suggest that each county have two.
Well, and I'm going to go to my fellow supervisors and suggest that to them, because I think there may be room for conversation with that. Absolutely, John. And that is going to be my first point of conversation, but I think we can find some resolution on that because those meetings are agendized and we do know what we will be discussing. And so that's helpful also.
I might recommend if you get pushback on the two is have a single spokesperson, but another person sitting in listening to the dialogue.
So, thank you. And that's that would be another point of conversation. Supervisor Campbell.
Yeah, I just had a question first, and then I guess I'll hold my final comments and to see if there's any public comment. But the question I had for staff was, and I hear the recommendation from Supervisor Rotifer, and I think that's a good one. But if we were to go ahead with a separate council of this type of what's being proposed, if there were costs incurred to that, Dr. Surjenko's time, any time from your office or from public health contributing to that, would we be able to charge those costs to the CARES Act, or would they be incurred by the general fund or some other county funding stream?
So in order for us to charge our time to the CARES Act, it needs to be substantially dedicated, meaning that for a week, we would need to have substantial time. So not 2 hours in a week, but maybe 25 hours in a week. It's only then that we look at charging that time to the CARES Act.
Okay.
And that's actually in the guidance.
So any costs would come out of the general fund?
Or public health.
Or public health?
Right.
Okay.
Yep.
Okay. At this time, I'm going to ask if there's any public comment on this item. There is no public comment. Okay. I think I can hear what the direction is going to be, but I would ask for so actually, if we go with Supervisor Rotifer's path, that really is what we are doing, with the exception of the Yosemite Gateway Group.
It follows my line of thinking, so
Yeah.
I'm quite supportive of it.
Okay.
Yeah, and I agree. I support the work that Supervisor Brennan has done with Yosemite Gateway coordination and with RCRC, and then the work that Supervisor Rotifer can contribute through CSAC and coordinating with some of these other groups.
And Supervisor Kirk, because he's been very active in it.
I was getting there, and then finding a way to bring Supervisor Kirk in to provide input in these areas, I think would be the way to go.
Anaya?
Just so I can clarify, you guys are proposing to work with the Gateway community, CSAC, RCRC, bring this information to. Here, let me just, because I can count to 3, so I understand it sounds like we're not going to move forward with it. I just want to be very just upfront and honest. When Governor Newsom comes out and says we're not going to go back to a green, there's not going to be the way things were. And so for me, what I just wanted to understand is that anybody who works in public health or anybody who gets elections from the state, it's going to be very difficult to challenge that tier system. So if we're not going to set up this committee, which is what I think we just need an outside voice presenting information to this board. If that's what you guys decide to go with, so be it. But these conversations, they need to happen, and they need to happen fast, because I know our board has been requesting this from the prior public health officer. We haven't got the information. And so I'm just very hesitant moving forward that if this information doesn't come to light and isn't presented to the state, which is what me and Carl are going to work on, that this is going to go nowhere. So we'll give it a shot. Again, I disagree. I think we should form this committee and have an outside influence to inform our board. But if you guys choose not to vote that way, then I will do everything in my power to support the direction that the entire board goes. I just want to be honest. we have our state leader saying we're not ever going to go back to the way things were, and nothing that we do is going to change that, it sounds like. So.
Okay. So, and I also want to encourage you and Supervisor Rotover to continue to work with this group of folks as a citizen advisory group, because I think they will provide valuable information for you.
And I did get a letter, and I believe we all got a letter. I can't remember the lady's name, but in pretty, I don't want to say strong language, she was very polite about it, but pretty a forceful request that at some point in the fairly near future that we look at having some kind of a town hall where public can make their input known, and I think that that's very important. And maybe we look to staff to to try and set that up. Obviously, it will be challenging with COVID restrictions. You're not going to be able to have a mass gathering, but perhaps that's something that our Health and Human Services Agency Director could look at the possibility of setting up.
All right. With that, we are going to recess for lunch, and we will reconvene at 1:30. Thank you. And Tracy, can you kind of... All right, we are going to reconvene the Board of Supervisors meeting. And I think that, let's see, let's do reports next. And I will start with County Council.
I have nothing this time.
Supervisor Gray.
Yesterday, the Commission on Aging was held in Groveland via Zoom, and I think we had good participation from the Groveland group, and talked about the fire and the issues that senior have up there. And I think that we did a pretty good job of taking care of those needs. But the thing that I stressed, and I want to stress it to the public, that they really have to make sure that they get on the Everbridge system. They really have to understand that they do have a responsibility to take care of themselves. So many people anymore do not have a portable radio, battery-powered radio. Most of us have cell phones, but not everybody. But with that radio, you can get a lot of information, and I think we're kind of negligent in not a lot of people not having those. So, but there was good comments about how well things went. You're always going to have somebody that just didn't know, but I just want public to realize that some of this is on them. They have to really do their part in being ready, because it happens quickly. We went from a warning to evacuation at 10 o'clock at night, and that's not much notice. So you need to be ready. Anyway, that's my report. I'm good.
Supervisor Rotifer.
Sure. Before I get to my report, I'd just like to echo what Supervisor Gray just said, because I think it's very, very important. And we went through rimfire, and we had evacuation warnings, but I don't believe we ever actually got to an order. If we did, it was for a relatively short period of time. But that can happen. An evacuation order can happen to anybody. It can happen in any district. It can happen in any neighborhood. And you really need to have thought it through. You actually, and I think my wife and I have thought it through, and we've done the preparation and everything. The one piece that we haven't done that we probably should do is actually exercise it. Because, when somebody says, hey, get out as fast as you can, you need to kind of know what you're your little checklist is without going into the computer and printing one out and checking it off. So everybody ought to think about that. As far as my report, in the last several weeks, because I don't think we've done a report in a couple of meetings, but I'm going to cover several things. And some of them I've mentioned, but I want to highlight them. I mentioned in earlier agenda items, but I want to highlight them. One is I'm working 3 traffic calming issues in my district. One is Main Street in Jamestown. I alluded to the fact that staff is working on putting 3-way stop signs at every one of the intersections that there's currently a single stop sign at. People are using that, I call it a flyway, but that little right-hand exit ramp off of 108 coming up the hill and going through Jamestown at a relatively high rate of speed. That street is effectively one lane with parking on both sides of the street is effectively one travel lane wide, and we're going to kill somebody jumping out from behind cars if people don't slow down. So we are doing that. We've got a similar problem also in Jamestown on 5th Avenue. A lot of people are now using Campo Seco and Seco streets both ways to avoid the stoplights on 108. And they're not slowing down going past the state park and the elementary school there as they come down 5th Avenue. So I really ask the public to be conscious of what you're doing in those areas. Again, Jamestown L is not going to reopen, but that doesn't mean there aren't kids there. So it's really, really important. There is a long-term project there to. It's more of a complete streets kind of project than a traffic calming project, but we're looking at ways to incorporate some traffic calming methodologies in that project. And the other one that I would encourage people to slow down on is coming around on Jackson Street in Columbia State Park there between the St. Charles Saloon and the Mercantile. There is a stop sign there, but people come roaring right up to the stop sign, and they're coming either out of the college or they're coming from Big Hill and everything, and that's a very high traffic area. A lot of kids are going across, and they don't always use the crosswalks. They're going across there, going from the park up to the old schoolhouse, and so please slow down there. We're looking at what we can do in terms of traffic calming devices there as well. And we've had a couple with the Main Street project. We've actually had a couple of community meetings. One was with some interested business owners in Jamestown, and then the second one was with the Jamestown Promotion Club. And so we've had those meetings and let people know what we're doing. But again, those are really, really important. And then on the COVID front, again, I'll just reiterate, I'm not going to spend a lot of time on it, but I've had 2 meetings, CSAC meetings, and it looks like we're going to have another meeting weekly now, trying to emphasize Dr. Galley, the Secretary of Health, is at the state. Got an earful at a CSAC board meeting from a bunch of a bunch of rural counties, and he held about a half an hour that turned into about 40 minutes call that both myself and Supervisor Kirk were on, and he's committed to meet with a small group of rural county supervisors weekly in order to hear the specific concerns, the unique concerns of rural counties. We aren't the same as urban counties. We're not even the same as suburban counties. And actually, I think that there's probably 3 different families of counties, and some could be in multiple families, but there's urban/suburban counties, there's rural counties, and then there's high-intensity ag counties. All three of them are experiencing different patterns of transmissibility and different levels of morbidity associated with it, and the state is still applying, although it's a tiered solution, but Orange in a urban county is being treated the same as Orange in a rural county, and the same as Orange in a highly intensive agricultural county. And I think that there's a case to be made that those ought to be different. So those are the things that I've been focusing on most intensely. Other than that, it's the normal be a supervisor kind of person. Thank you.
Supervisor Campbell.
Thank you, Chair. Yeah, so my report can be summarized with two words: distance learning. Just speaking with my family's experience, we really have to give a shout out to the teachers in our community and the work that they do, because it's very difficult doing distance learning with children in the house. And so all the parents out there that are struggling with this, you're not struggling alone. So I just wanted to start by saying that. One of the things that I wanted to mention was the Board of Supervisors Housing Policy Committee met last week. Supervisor Gray was in attendance as well. And we had some pretty substantial discussion about the adoption of a accessory dwelling unit ordinance. And I think that we've come to a really good policy on that the board will be hearing more about in the near future, I hope. The last thing I wanted to mention was, can't remember if I mentioned this last time. I don't think we didn't do reports last Tuesday, did we? Okay. Just wanted to make sure I wasn't repeating myself. So I did tour the burn area for the mock fire in the Groveland area, and it just really highlighted to me how much preparation paid off. That we, there's still a lot of work to do, but we really have in this county, I think, learned the lessons of the Rim fire in 2013. I think it was mentioned earlier when Liz was giving a presentation about this last week that there was some vegetation management done along Priest Coulterville Road. And that's exactly where the location where CAL FIRE and our brave firefighters were able to stop the fire was on that road that had treatment. And that's going back to a grant that our county received in 2018. So it took foresight, and it took a lot of work on the part of a lot of individuals, not just the firefighters, but of course they're the ones on the front lines putting their lives on the line. But we all have to kind of think ahead, and I think the mock fire really shows what can happen when you do think ahead. So
could I just chime in there a minute on that? And a lot of that work on those fire lines were a result of SWIFT work. Yes. Also. And the secondary lines that they had in place were ones that have been established over the years through the cooperation of BLM, U.S. Forest Service, and others. And they had some good preparation in place and already mapped out, ready to go. And like you said, it stopped at Priest Coulterville Road. That was one of the smart things that we did, and it really shows the value of that organization. The South County, and as well as the 108 Fire Safe County Council, those proactive work on those fire breaks is just something that we just need to really continue and make sure we keep stressing the funding to keep them maintained.
Right. And I will end it there. I'll let.
Well, I just add that it's not just doing the work initially, but all of that has to be maintained. So that's important.
Supervisor Kirk.
Carl, Supervisor Rutherford spoke about the CSAC meeting in the meeting with Dr. Gallet, so I won't touch to that. And I kind of alluded to those conversations on item number 16. So other than that, just my regular duties, but I'm looking forward to more conversations with the state and getting involved more with Dr. Surjanko and their team so we can move this conversation along. Other than that, I'll just leave it at that. Thank you, guys.
CAO Riggs. Ms. Ryan. Okay. And so I, too, have just really been doing the normal course of work, but a lot of that, for example, the Area 12 Agency on Aging meeting that we had this last week, we did really talk again about this evacuation and preparedness and being ready to go and having your go bag. And that includes thinking about pets and animals. And as Supervisor Rutherford said, it's probably a good thing to actually walk through it. So preparedness, preparedness, preparedness. We cannot say it strongly and loudly enough. And then the other piece that I would report out on is the Insurance Ad Hoc Committee, which I have been chairing for the last year for RCRC. We have done a lot of work with that. The final report was supposed to be out in August. Again, with all things COVID, that report is coming out this week at the RCRC meeting, and I will be sharing it with fellow supervisors after it has been adopted by RCRC. I want to make a couple of points. First of all, much like the staff here, we have phenomenal advocates at the state level, and so I would be really remiss if I did not point out the tremendous effort of Paul Smith, Stacy Heaton, and others that are working tirelessly. They are working around the clock, literally, on these issues. We spent an enormous amount of time working on this insurance issue, and I will say sadly that there were two pieces of legislation that were moving through the Assembly. One was a piece by Assemblywoman Dolly that we had taken a position on as the Insurance Ad Hoc Committee. It was not a fix, but it was a start. Unfortunately, in the wee hours of the morning, I think at about 1 o'clock in the morning, that legislation was pulled. The other piece of, I will say, it also was in the form of legislation which was pulled, is around the idea of a permanent funding mechanism if we are really going to make a difference when it comes to vegetation management and capacity to do home hardening and some of the ingress and egress issues that are really going to make the difference. These are big ticket items. And again, as a committee, we did support the legislation that looked at, there was a tax that was associated with the public utilities bills, and it was really equated to $1 a month per household in the state of California, so it was roughly $12 a month. And that was sunsetting and looking at reauthorizing that specifically for the issues associated with our inability to, where we're at with fire response and being able to stop these monstrous fires. Again, unfortunately, it was pulled in the wee hours of the morning. I believe it will come back. We as Californians, and it's not just Tuolumne County residents, but as Californians, are going to have to look for a funding mechanism. It is a reality that is borne by all of the residents of California, because when we look at air quality, water capacity, even the fire threat, it's no longer just in the SRA counties. It's across the state of California. And so I am certain that this will be coming back in a much more robust way in the following year. And it's just going to be important to be really advocating and just helping generate the awareness that if everybody can contribute a very small piece, it will make a substantial difference in our ability to actually do all of the needed work. That really is going to come down to three pieces in that report, which is around vegetation management, home hardening, and then ordinances within county jurisdictions or city jurisdictions. So with that, I will conclude. I am certain that RCRC is going to continue this effort going forward and understand that we have, I think, a good start and a good recognition of where our challenges lie, but it is going to take a very concentrated, ongoing effort in the future. So with that, will you please read our closed session items?
Item 14, closed session conference with legal counsel, anticipated litigation, Authority Government Code Section 54956.9 D2, one case. Item 15, closed session conference with labor negotiators Tracy Riggs, County Administrator, Eric Earhart, Assistant County Administrator, Ann Fremd, Human Resources Director, Kimberly Phipps, Human Resources Analyst, and Debbie Batista, Auditor Controller, Authority Government Code Section 54957.6, all bargaining units. Item 17, as Tuolumne Public Power Agency Board, closed session, conference with legal counsel, initiation of litigation, Authority Government Code Section 54956.9 D4, one case.
Is there any public comment on the closed session items? There is no public comment. Do we anticipate a report out? Yes, we do. Okay. So we are going to adjourn into closed session.